May we all stand for the arrival of the President, please? President of the Republic of Seychelles, Mr. Weval Wamkalawan, Speaker of the National Assembly, Mr. Roger Monsien, Ministers, members of the National Assembly, Patron of the Nurses Association of Seychelles, Mrs. Maxouzi Mondon, WHO representative for Seychelles, Dr. Rex Mapenje, nurses and midwives, distinguished guests, ladies and gentlemen, good morning, all.
A very warm welcome to you all to this important symposium for the nurses by the nurses in commemoration of two main international events. You may sit down, sorry. Of nursing and midwifery. On the 5th of May, it was the International Midwives Day commemorated under the theme Follow the Data, Invest in Midwives, and the International Nurses Day 2022, celebrated on the 12th of May annually. My name is Shelley Wawu, a newly qualified staff nurse currently working at the Northeast Point Hospital. My colleagues is Miss Beryl Valentin, Program Manager of Sexual and Reproductive Health, working at the Family Health Unit. We are both employed by the Ministry of Health, and we shall be your MC for this special event. This year has been dedicated under the theme Nurses, a Voice to Lead. Invest in nursing and respect rights to secure global health by the International Council for Nurses Worldwide. Before we commence, may we all stand for a minute of silence to remember and honor the nurses and other healthcare workers who have lost their lives due to COVID-19 or while working during the pandemic. Our heartfelt condolence goes to the family of Mr. Jerry Govinden, who have contracted COVID-19 virus. Miss Bernadette Rose Sultan Labos, who passed away during the pandemic, and we also honor Mrs. Janet Samson, the first president of the Nurses Association of Seychelles of 1976. Our sincere condolence goes to all health workers, their family, and patients who have lost their lives due to COVID-19 complication. May their soul rest in peace. You may stand up, please.
Okay, we may sit, please. The aim of this forum is to value the contribution of nurses, midwives played during the COVID-19 pandemic by protecting, supporting, and investing in the nursing midwifery profession in Seychelles. The Nurses Association of the Republic of Seychelles has organized this symposium for the nurses and midwives by the nurses and midwives in Seychelles. This event would have not been possible without the unwavering collaboration with our international parent association, the International Council of Nurses, and our local partners in the health sector, namely the Ministry of Health and the Private Clinic Association. May I now introduce you to the program for the half-day symposium. It is composed of the main sessions. Session 1 is the launching of the ceremony, where we should hear from the 5 main speakers who shall pronounce themselves on the following thematic areas through keynote addresses and message of the achievement and challenges COVID-19 pandemic on nursing profession in Seychelles. Session 2 will be mostly the scientific session of critical roles of nurses and midwives played during COVID-19 epidemic in the Seychelles, which will then followed by a break. Session 3 will be plenary session capturing action and recommendation for the improvement of nurses and midwife care and services in Seychelles. Please kindly refer to the program on your seat for additional information of the outcome.
For Session 1, the lamp lighting ceremony is an auspicious occasion in every nurse's life, held in reverence to Florence Nightingale, the lady with the lamp. Nursing is the only profession that follows lamp lighting ceremony. Light, as a symbol of knowledge, removes ignorance and is a lasting wealth by which lots could be achieved. The lamp lighting ceremony formally recognizes the students' entry into the nursing profession as well. the Nurses Association of Seychelles is also sending messages of solidarity and support for our colleagues in the war zone, especially Ukraine, as shocking news and images show nurses struggling to keep working while under Russian attack. May I now call upon a retired, well-appreciated nurse leader. The last post she held with the Ministry of Health was the Director of Nursing for Hospital Services. We call upon Ms. Yolande Hélène Nisset, Mrs. Yolande Hélène Nisset, and a newly qualified nurse, Mr. Julio Charles, to do us the honor to light the lamp and the candle in remembrance of the Ukrainian nurses. Thank you, Mrs. Nisset and Nurse Charles. The light has been enlightened as a symbol of hope and comfort to those who are suffering. Graduates light this lamp as a commitment. A round of applause once more, please.
Founded in 1976 by a group of nurses and nurse leaders who felt the need to have a voice for nurses by nurses. The Nurses Association was established, registered on May 31st, 1977, under Article 2 of the Constitution. NARS promotes the highest possible standard of nursing practice, encourage professional and educational advancement for nurses, and to ensure that all people, irrespective of nationality, race, color, or social origin, may have optimal nursing care. At the same time, improves and promotes the socio-economic welfare of the nurses and midwives. Ladies and gentlemen, let me now invite the President of the Nurses Association into her third mandate of Chairperson of NARS, and as a member of the National Assembly, Honorable Mrs. Rosie Bistoke, to deliver her keynote address. Honorable Ms. Bistoke, please come forward.
President of the Republic of Seychelles, Speaker of the National Assembly, ministers, nurses and midwives, distinguished guests, ladies and gentlemen, good morning. On behalf of the Executive Committee of the Nurses Association of the Republic of Seychelles, commonly known as NARS, and on my own behalf as the chairperson, I warmly welcome you all to this special event hosted by the association and in collaboration with the Ministry of Health, the International Council for Nurses, and the Private Clinic Association of Seychelles. I thank you for taking time off your busy schedule to be amongst us nurses and midwives today. Before I proceed, let me also bring comfort to the families and friends of nurses who have suffered and lost their lives because of the COVID-19 virus. The Nurses Association of the Republic of Seychelles has contextualized the theme as Nurses, a Voice to Lead, valuing the contributions of Seychellois nurses during the COVID-19 pandemic. The Nurses Association of the Republic of Seychelles, as they have mentioned beforehand, was founded in 1976 by a group of nurses and nurse leaders who felt the need to have a voice for nurses by nurses. In the initial stage, such an idea was not so welcoming, but by some nurses in influential positions. They failed to understand how an association would promote growth and change in the nursing profession. The establishment of NARS was seen as a threat to the status quo. However, such opposition did not deter the motivation of the nurses who initiated the idea. They continued relentlessly in the task of forthcoming the association to improve the quality of healthcare in Seychelles. Nurses from various fields of nursing were consulted in the creation of NARS. After the initial meeting of the founding members, the constitution of NARS was drafted. Nurses Association was registered on the 31st of May, 1977. That's a long way back. For the past 45 years, under the direction of many nurse leaders, who some are here with us today, and sadly some of them have left us already, the association has been nurtured to what it is today. The organization continues to develop strong support from its members and the Ministry of Health. On my behalf, especially as a president, we have here today one past president who was before I came into the position. Let me congratulate Ms. Elsia Sino, who gave her full support throughout her tenure into the association. A big round of applause, Ms. Elsia. So this is Ms. Elsia Sino. Thank you, Ms. Elsia. Nurses are frequently the first and highest level provider for primary and tertiary care of services. They are essential to expanding delivery of health services to remote populations. Evidence shows that nurses are also instrumental in improving health sector productivity and patients' outcomes. They play a very significant role in providing and maintaining the healthcare system. The local theme adopted by the Nurses Association in commemoration to the International Nurses Day 2022 is not a coincidence, not even a superficial statement, but it has been derived based on facts, not fiction, on real-life experiences of nurses fighting and winning the battle against COVID-19, not only for themselves, but for the community of Seychelles. I salute the nurses of Seychelles for not only winning the battle, but for gradually winning the war against COVID-19 pandemic. Infections under different variants, you name it, Omicron, Delta, Alpha, and many more. May we give all the nurses and midwives in Seychelles a big round of applause for staying steadfast on the battlefield without relinquishing their combat against COVID-19. Thank you. In this context, the Nurses Association would like to stress that though the nurses and midwives are at the forefront of the healthcare system, nurses are everywhere, staffing our clinics, hospital wards, and units. In some situations, literally working until they drop, while are actively embracing the challenges presented by COVID-19. This is a clear message that the need for nurses, midwives have never been greater in responding to this dire and unprecedented health crisis. As nurses, we are doing what we have been we have to do. We have been educated and prepared to move forward. As nurses, we have the knowledge and skills to deliver the care needed in all phases of illness, tragedy, and in reassuring, informing, supporting people in the community of Seychelles who have and are still frightened, worried, and wanting to stay well. As we have seen throughout history, nurses are well able to think outside the box and develop creative and innovative situations to all manner of problems, mysteries, and challenges. However, there remains much more that needs to be done. For one, is the speed of COVID-19 in the fight against the epidemic. Nurses and midwives are working around the clock. In the working environment created by COVID-19 for nurses and midwives in the promotion of they have not been having an acceptable work-life balance. Nursing and midwifery are caring professions, and they are often placed the needs of patients before their personal family needs. This could result in compassion, fatigue, burnout, chronic stress in the professional life of our nurses. In addition, working different shifts, multitasking, and inadequate staffing can also add to this massive problem. This is often amplified among female nurses who do not have to deal with stress at workplace, who have to deal with stress at the workplaces, but also shoulder a huge responsibility of their family needs with overladen responsibilities like household work, caring for their children, parents, relatives. Female nurses can feel pressurized and stressed at home as well as in the workplaces, and also including the male nurses. This cycle of work and family can endure in a struggle to balance between personal and professional life for all nurses. The work of nurses and midwives during the pandemic varied from normal routine work during the outbreak of COVID-19 to cope with new protocols, procedures which were implemented, which has to be learned and updated very quickly by nurses and midwives. At the same time, a lot of changes took place at home with regard to finance, childcare, and other additional support system required during the epidemic. All these resulted in alteration of a work-life balance of nurses and midwives during the pandemic. Yet there was also, as we all know, that poor work-life balance can lead to severe distress, depression, and have a negative impact in the nurse's life. During the pandemic, the association took an observational and very active supportive role. Firstly, its annual plan of actions for the years 2020-2021 were derailed. A COVID-19 response plan was developed and implemented. Within the observation role, the association also noted certain areas where better support and education can be invested in the nursing profession to improve the important leadership role undertaken by nurses. The association is concerned about the unavailability of support mechanism for the nurses. NARS wanted to do more, but resources were not forthcoming. The COVID allowance, was it justifiable? Was there equity in its allocation, taking into the consideration of the nature of nursing and midwifery? Should there be alternatives for rewarding these nurses and midwives? Based on the diversity of the technical presentations by nurses which will follow, the Nurses Association hopes that lessons learned from the COVID-19 pandemic be drivers to improve the nursing and midwifery profession and subsequently transforming and better care for the Seychellois community. Let me wish all the nurses and midwives a happy Midwives and Midwifery Day and Midwifery Week. Though you are all dedicated midwives and nurses, and hoping for a fruitful and frank deliberation during this forum, and bring forth tangible recommendations to further improve the nursing practice. I thank you for your attention.
So thank you, Mr. K, NARS President, for the roles the association played in supporting the nurses during the COVID pandemic through an observatory role. Nurses are thankful.
The Nursing Directorate developed a robust COVID-19 mapping and development plan for the nursing and midwifery workforce in Seychelles in May 2021, aimed at the protection of the population and staff from COVID-19 and to ensure the continuum of care, access, and delivery of quality healthcare services by all people living in Seychelles. May I now invite a nurse midwife who has attained the highest degree in nursing in Seychelles, works in the Secretariat of the Principal Secretary of the Ministry of Health, Dr. Gillian May, to deliver her keynote address. Dr. May. Round of applause, please.
President of the Republic of Seychelles, Speaker of the National Assembly, ministers, nurses and midwives, distinguished guests, ladies and gentlemen, good morning. The COVID response would have not been possible without nurses and midwives. Nurses are the forefront of the COVID-19 response. They were there at testing and screening stations. They were there with close contact when they had to undergo quarantine away from their loved ones. Nurses held the hands of the confused elderly patients of the family hospital, bringing comfort, peace, and reassurance. Nurses manned the 141 COVID-19 helpline, and they were also involved in the contact tracing. The successful vaccination campaign would have not been possible without the many nurses who faced the long queue, very often bearing the brunt of the public's impatience and frustrations. More than 200,000 doses of COVID-19 have reached the aim of our fellow citizens, protecting lives and also contributing to economic recovery. Nurses continued addressing all of the increasing non-COVID related work that persists. They carried and still carry the greatest burden of the pandemic response, faced with stress and exhaustion from the day and night shifts, and disproportionately exposed to the risk of the infection. Nurses are the real heroes of our time, who continue to take care of people's health and lives daily. Our nurses remain the backbone of the Seychelles health system, accepting the new reality of working in a pandemic. We have remained strong and resilient, ensuring that the population continues to get excellent care. Over the past 2 years, we had to open tight doors, negotiate slippery terrains, and overcome various obstacles. And we felt like giving up on more than one occasion. Because we have learned never to give up, pursue our goals, and we have a dream. We persevere until we realize it. Our nurses blaze the trail and set the example. We may need to reassess and revise our opportunities from time to time, but giving up has never been an option. Going forward, all prevention and preparedness crisis response plan must include nurses at all levels. The epidemic has demonstrated the intricate critical thinking nurses use in providing patients care. Nurses are scientific professionals whose activities are based on research. As we continue to handle current difficulties and our population's expanding health needs, adjust to new treatments and technology, and work across sectors, it is critical that nurses have higher education. This encompasses graduate degrees as well as specialties. We know that the government has already committed itself to investing the higher education for our nurses and midwives. Today, our nurses are experiencing high levels of exposure to potential psychological trauma events, exacerbated by violence in the workplace. To get through this situation and to meet the current and future health needs, this will require a collective effort to adopt systemic change to lessen or eliminate many of the risk factors affecting the nursing and midwifery professions. It is time to fully recognize and address the stresses and burdens that nurses bear on behalf of societies. We have seen the evidence and understand the need for investment and protection. Now is the time for action. As the Chief Nursing Officer, I take this opportunity to thank all the nurses and midwives who have tirelessly responded to the pandemic. We will continue to train and support nurses to be able to deliver services in peaceful times and crisis. Today, as we celebrate International Nurses Day, we also remember our colleague who have lost his life to this virus. I wish you all a happy Nurses Day. Thank you.
Thank you, Dr. May, for highlighting into the impact of COVID-19 on the nursing workforce in Seychelles. Can we give Dr. May another round of applause, please?
In responding to the outbreak, the Seychelles government developed a Seychelles National Response Contingency Plan of COVID-19 through the National Multisectoral Public Health Emergency Steering Committee, chaired by the Minister for Health. The aim of this plan is to guide on early detection and early response for COVID-19, caters to the reduced transmission and to reduce mortality and morbidity in Seychelles. Ladies and gentlemen, I have the privilege to invite nurse educator with a vast experience in health system of Seychelles, health management and policy development in the Commonwealth Secretariat to strengthen their health policies as well as contribute to national, regional, and global effort to achieve the Millennium Development Goals. May I call upon Minister Peggy Vidot to deliver her address. A round of applause, please.
President of the Republic of Seychelles, Mr. Wavell Ramkalawan, Speaker of the National Assembly, Mr. Roger Monsien, colleague ministers, Honorable Rosie Bistouquet, also recognize Honorable Regina Esparon, other members of National Assembly, Patron of the Nurses Association, Mrs. Maxuzimodo, invited guests, ladies and gentlemen. It is indeed an honor for me to stand here today to address you, our nurses of Seychelles. It is exceptionally pleasing to me because I stand here also as a nurse. And therefore, as I say, Happy Nurses Day, I'm also, included in that group. So, Happy Nurses Day to all our nurses in Seychelles, and also Happy Life's Day, which we also celebrated last week. Nursing leadership has transformed public health and health workforce from the time that secular nursing was born. Florence Nightingale not only founded nursing, but she founded a movement which could contribute enormously to the development of public health and a professional group of health workers who will, through the decades, become by far the largest group of healthcare provider. She also set the scene for nursing leadership in public health. Today, nurses are leaders in a variety of health settings, such as we expect that nursing should be central to health and social policy development. Nurses can bring their creativity and professional perspective to the transformation agenda. They are well placed to drive efficiency and effectiveness improvements while always providing quality care. The reality, however, is that in spite of the 28 million nurses, which form the largest proportion of health workforce globally, nurses remain in large part mainly policy implementers rather than the policy drivers. During the pandemic, it was acclaimed that nurses were the heroes, the soldiers at the forefront. They remain at the forefront as soldiers. We ask ourselves, how many were generals? Looking at strengthening the strategies that we required for the response. In answer, very few. So, nurses as a workforce need to show that we have the ability, we have the knowledge, we have the expertise to take on leadership in health. To address this issue, our workforce need to demonstrate efficiency, effectiveness in whatever we do. We function as nurses in a variety of settings and therefore occupy a special position as the interface between the community and the health system. Nurses are therefore well placed to have first-hand knowledge of how health policies impact on individuals, on families, and on communities. They also understand the complexities of implementing health programs and the challenges faced in providing cost-effective health services and influence health policies. We realize, and we've seen, that there are many initiatives which have started to improve nursing contribution in health policy, and nurses welcome this. And in health management, we welcome this. The recent Nursing Now campaign, which was designed to improve health globally by raising the profile and status of nurses, has created a momentum which will recognize nurses as vital agents of change who can, through their leadership, improve health and transform healthcare. I've been asked to talk about how nurses can be that effective workforce who can bring about the kind of transformation within our health system. Therefore, the question, what can nurses do to improve health system efficiency? Do we have a cost-effective nursing workforce? Nurses as a force for change have opportunities to improve efficiency, to reduce waste in collaboration with other health professionals and decision makers. hundreds of decisions a day or omit to make certain decisions during their daily lives. And all these decisions, or lack of decisions, in one way or another, affect health efficiency, affect effectiveness of our services, and invariably affect patients' outcomes. This morning, allow me to just visit a few of such opportunities where nurses are making a difference or potential for making more differences exist. We've talked of minimizing waste. As frontline workers, nurses have first-hand experience and knowledge of where the most waste occurs. As caregivers, they know what patients need and understand the supplies that are most often used and the supplies that most often go unused. Whether it is at the bedside, whether it is in a health center, whether it is in a labor room delivery suite, whether it is in the operating room. Therefore, if we want nursing contribution, nurses must be part of that conversation when it comes to procurement, because they have a contribution to make on what to be procured, the quality, the quantity, and what is needed to address patients' needs better, because they are in direct contact. As nurses, also the question, how much wastage? Because whatever decisions you make about wastage or not wasting affect efficiency. To be that efficient health workforce, therefore, this question needs to be asked. How often do we open packs that need not be opened? How often do we say to ourselves, I only need one forceps, but did you communicate to the unit that these forceps could be packed individually so that you did not have to go and open a pack? This is just some of the questions about supplies. Let's come to time wastage. Professional time as well as clients' time. To make us efficient, we have to render the services that meet the needs of our clients. Time is important all around. Just an example of how we sometimes, through inaction or lack of decision, we waste certain times that is sort of important. Let's look at something as a patient requires an appointment. Instead of saying, okay, I'll lift up the phone and get an appointment, we tell the patient to come back next week. So the patient, time is wasted, the money is wasted. She has to take a bus, maybe go back up to Takamaka, and then take another bus next week to come back down. So we do have all these areas where efficiency can come in, and it relies on how efficient are we as a health workforce. That buzzword these days, everyone talks about evidence-based practice. We're all using this, and each time you talk to health professionals, it keeps coming back. We're doing evidence-based practice. Very good. I applaud that. Nurses understand the importance of evidence-based practice. And nurses, in many instances, stay up to date to know what is going on. Because evidence-based practice, we know, is foundational to nursing and essential for establishing and maintaining quality and safety in the healthcare environment. And therefore, nurses rely on evidence-based practice to determine what treatments will provide the best outcome for the patient. They use evidence-based to guide their change in practices. And they not only use what is available, but even here in Seychelles, we've seen our nurses develop and implement clinical evidence-based practice guidelines through observations they've made, through studies that they've made. Therefore, this approach helps the workforce to be efficient, both in terms of patient outcome as well as cost savings for health. But we also ask ourselves, whilst we have some nurses who are doing that, is it the norm across the whole profession? Can this be improved so that better patient outcomes, can be realized? We ask ourselves, how can nurses bring efficiency, effectiveness into disease prevention and health promotion? And here, we all know that this is an area where nurses can make a difference, is making a difference, but it can be multiplied tenfold. Because at the forefront of the health system, we are best placed to bring on that area, in the area of prevention and health promotion, what is required. Much too often, we see cases being, diagnosed late, especially cancers. And the sad thing, in many instances, these patients have been making calls to health centers, doctors, nurses, and they've been left behind. How can we make the workforce, nursing workforce, more effective in bringing about, in working in prevention, in bringing about early detection of cases, be it non-communicable diseases, be it cancer, be it anything else that the patient may have. So as a professional group, this is the area where we need, and we are morally responsible for really making a difference. So, like we've done, for example, in prevention control, I feel nurses are well placed to do that. But we need a workforce that looks at what changes are required to bring about that transformation. During the pandemic of COVID-19, nurses have been heralded as champions in developing infection prevention and control. Here in Seychelles, this very important function lied in the hands of nurses. So nurses, we could see the workforce really leading. Nurses have taught people to wash hands, to sanitize. Nurses have taught all health professionals to use the PPEs. And even at this stage, even Mr. President talks of donning and offing. So nurses have really moved on with this area. We know that. There are many other areas that I can touch where nurses can and should be developing strategies to be leading, to be that effective workforce. And we know that experience have shown that having the right numbers, the right skills in the right place at the right time will improve health outcomes, the quality of care that's delivered, as well as patient safety. The question is, do we as a workforce consider this in the deployment and scheduling of our staff? I leave that question with you. Nurses, to be the effective workforce, need to be looking at task shifting, need to be looking and ensuring that they match the skills where they are needed. Are there people who are less skillful than you, able to do certain things that you're doing so that your time is better placed doing more complicated, more complex skills? Are we providing the care in a timely manner? We know, for example, that many complications could be avoided, could be prevented, if only certain things are done. Simple thing, pain management. We all know about this. Could pain management be, better applied so that mobilization is done sooner, so that this patient doesn't develop complications such as deep venous thrombosis, which retard his health, his recuperation, which is costly not only to us in health, but to the family and productivity out there in the community? Could your advocacy for a patient have led to his better management by his health team? Can your advocacy help a patient to be referred on time and for early diagnosis to be made? How often have you used your professional, cultural, and societal knowledge to influence the care and management of a patient? I could go on and on. But COVID-19, as has been said, has brought us a lot of challenges, but it's also helped the workforce to relook at how it works, to look at how, for example, to embrace technology. So during that time, mHealth became another word that entered into the health jargon. We've been using the telephone a lot to call patients, to advise patients, and to see how patients are doing. So let this workforce continue with that. Let the issue of not being able to contact a person because we didn't have transport be a thing of the past. Let us look at how we can embrace technology in health. We have many opportunities to improve cost effectiveness in health, and I challenge you to look at those and to take those. We need nurses to be at the core of the provision of cost-effective care. And to achieve this, we require strong nursing leadership. I believe in nurses, and therefore would like to enable nurses to work to their full potential. Let me, in concluding, leave you with this challenge. Nurses have been recognized as agents of change, but that force that drives the transformation in health, be the workforce that champion efficiency and effectiveness in health for better health outcomes for the patient in our country. To be that effective workforce, nurses need to be supported. I can assure nurses that my ministry will work with all of you, with the Nurses Association, to address this socioeconomic welfare issues which have been raised only this morning and those not yet raised. And as Florence Nightingale would put it, for us who nurse, our nursing is a thing which, unless in it we are making progress every year, every month, every week, take my word for it, we are going back. The more experience we gain, the more progress we can make. Let us be the voice, unquote, let us be the voice, nurses, the voice that to lead, to advocate for the investment in nursing so that we can be that cost-effective workforce for better health outcomes and global health. I thank you.
Thank you, Minister Vidot, as a political nurse leader in Seychelles, for reminding the nurses are not only the backbone of the health system, but also a cost-effective workforce of healthcare work system worldwide. Please give them a round of applause.
Before we move on to the next item on the agenda, do we know why nurses were created? If we do not know, then let us listen to Miss Tara Albert, who will recite a poem for us. Round of applause, please.
Good morning to you all. When God created nurses, in honor of Nurses Day, I thought the following would be a great gift to my fellow nurses in Seychelles. A good friend of ours emailed this to a nurse association. The author is unknown. An angel appeared and said, "You're doing a lot of fiddling around this one. And the Lord said, "Have you read the specs on this order? A nurse has to be able to help an injured person, breathe life into a dying person, and give comfort to a family that has lost their only child and not wrinkled their uniform. They have to be able to lift 3 times their own weight, walk 12 to 16 hours straight without missing a detail, console a grieving mother as they are doing CPR on a baby they know will never breathe again. They have to be in top mental condition at all times, running on too little sleep, black coffee, and half-eaten meals. And they have to have 6 pairs of hands." The angel shook her head slowly and said, "6 pairs of hands? No way. It's not the hands that are causing me problems," said the Lord. "It's the 2 pair of eyes a nurse have to have." "That's on the standard model?" asked the angel. The Lord nodded. "1 pair that does quick glances while making note of any physical changes, and another pair of eyes that can look reassuringly at a bleeding patient and say, 'You'll be all right, ma'am,' when they know it isn't to." "Lord," said the angel, touching his sleeve, "rest and walk on this tomorrow." "I can't," said the Lord. "I already have a model that can talk to 250 pounds grieving family members whose child has to be hit by a drunk driver, who, by the way, is laying in the next room uninjured, and feed a family of 5 on a nurse's paycheck." The angel circled the model of the nurse very slowly. "Can it think?" she asked. "You bet," said the Lord. "It can tell you the symptoms of 100 illnesses, recite drug calculations in its sleep, intubate, defibrillate, medicate, and continue CPR. Non-stop until help arrives, and still it keeps its sense of humor. This nurse also has phenomenal personal control. They can deal with a multi-victim trauma, coax a frightened elderly person to unlock their door, comfort a murder victim family, and then read in the daily paper how nurses are insensitive and uncaring and are only doing a job. Finally, the angel bent over and ran her finger across the cheek of the nurse. "There's a leak," she pronounced. Finally, the angel bent over. "I told you that you were trying to put too much into this model. That's not a leak," she said, the Lord. "It's a tear." "What's the tear for?" asked the angel. "It's for bottled up emotions, for patients they've been tried in vain to save, for commitments to the hope that they will make a difference in a person's chance to survive, for life." "You're a genius," said the angel. The Lord looked somber. "I didn't put it there," he said. Happy Nurses Day 2022, the nurses in Seychelles.
Thank you very much, Nurse Tara Albay. We are very touched by this poem, and now all we know that nurses are unique, made and shaped by God Himself. That is why nursing is a noble profession. May we give her another round of applause, please.
Ladies and gentlemen, NARS will also like to thank and appreciate the work and experience of one of our nurses who had led the Nurses Association for 6 years. Please, Marie-Antoinette Poirot, can you stand up? And give her a big round of applause. Thank you. Thank you, Madame Poirot. The Nurses Association of the Republic of Seychelles is also guided by an honorary patron who supports of our mission and program. Under her guidance and leadership for the past years, she had enhanced the credibility and generally bestowed an assure of goodwill on the association. I now have the pleasure to invite the honorary patron, Mrs. Maxuzi Modo, for her address. Mrs. Modo. A round of applause, please.
President of the Republic of Seychelles, Speaker of the National Assembly, ministers, nurses and midwives, distinguished guests, ladies and gentlemen, a very good morning to you all. I would like to start by wishing all our nurses and midwives a happy Nurses Day. International Midwives and Nurses Day is the day when we publicly acknowledge and express our appreciation for the various roles that nurses play in our lives. The value of nurses and midwives cannot be underestimated. At some point in our lives, everyone is either a patient or client requiring assistance, care, or love of a nurse. It starts with the midwife helping to bring us into the world and continues throughout our lives. The role of the midwives, who are usually the first to comfort us, along with the other nurses who provide initial care to newborns, infants, and patients in general, are invaluable indeed. This symposium seeks, amongst other objectives, to provide an opportunity for the Seychelles community to value the critical roles the nurses have played in the response to the COVID-19 pandemic. If we ever needed to be reminded of the importance of nurses for patients, as well as for community health, the COVID-19 pandemic has been and continues to be a loud wake-up call for everyone. We need to acknowledge that nurses are distinct from other healthcare providers because they have a wide scope of practice and approach to medical care. This is particularly the case in Seychelles, where nurses play an integral role in promoting health, preventing illnesses, and caring for all individuals, including those who are physically or mentally impaired. Our local nurses are known to be an important asset to doctors, as their roles sometimes extend to tasks and procedures beyond their normal duties. Whilst noting that nurses belong to what is known as the caring profession, we also remain mindful that as professionals, nurses need to go one step further and evaluate their own practice as well as the practice of others. Reflection on and inquiry into nurses' practice will provide reliable empirical evidence against which to measure the quality of nurses or nursing care, as well as evidence on which to base decisions about the future of nurses, nursing care, and the nursing profession. Patients, their families, and society in general expect nurses to be good at what they do. Therefore, in order to meet these expectations, understanding the qualities of good nurses is also critical in our endless endeavor to attract and retain the best nursing talent. Qualities such as compassion and empathy make the difference in caring for patients. They make nurses appreciate what their patients and their families are going through, enable them to focus on a person-centered care approach. Mr. President, ladies and gentlemen, no doubt you are thinking of all the numerous other qualities of good nurses that we need not only elaborate on, but what we should also actively promote. Nevertheless, good leadership skills, as the Minister has said, is another essential quality that I would like to highlight in favor of our nurses. The call for stronger leadership from our nurses and midwives in our health system is still relevant today in view of the more challenging health issues like the COVID-19 pandemic. Adequate training and appropriate mentorship can also teach lessons on how to become a great nurse or midwife at all times and not just during a health crisis. In the words of Florence Nightingale, may we hope that when we are all dead and gone, leaders will arise who have been personally experienced in the hard, practical work, the difficulties, and the joys of organizing nursing reforms, and who will lead far beyond anything we have done, unquote. Our appreciation for the work of the nurses can translate into positive, tangible ways in which we care for and reward our nurses and midwives. Ultimately, it will impact positively on our country's ability to attract and retain Seychellois nurses and midwives in our health system. Our nurses know their value, whether or not they feel appreciated. However, if they don't, they may be saddened by the thought that they are in the wrong profession. Nurses' Day is also an opportunity to congratulate the newly qualified nurses and wish them success in their profession. Thank you for choosing to be a nurse. On this note, may I remind our experienced nurses of the critical role they play in creating a positive and nurturing environment for the new graduates to learn and grow. I also salute the nurses who have retired from the profession, taking with them years of knowledge and experience that cannot be replaced in the immediate. Many have left us, but they will be remembered for their devotion to the profession as great caregivers. My dear nurses and midwives, we acknowledge and appreciate how much you have to give, sometimes in difficult circumstances. Our expectations of you are high indeed, and we realize that sometimes you are stretched to the limit. Today, I call on your understanding, commitment, patience, and determination to remain in your chosen profession. Continue to deliver with love and compassion. It may not be easy at times, but when you make your patients feel that they are important, they will also consider you as important to them. Be a parent, a brother, a sister, and a counselor when you have to. And remember that a small word of comfort goes a long way and often brings a smile on a sad face. Needless to say, our nurses need to be taken care of as well. We need to continue supporting and encouraging them. I would like to thank NARS for organizing this symposium as a platform for reflection for our nurses. I hope that you will continue to advocate and remain a strong voice for our nurses and midwives. May Midwives and Nurses Day 2022 be the start of a fulfilling and rewarding year for you all. Stay safe and stay blessed. I thank you for your attention.
Thank you, Mrs. Mordaunt, for your enriching support towards further development of the leadership opportunities towards the Nurses Association, and we look forward for your undivided support to leverage the networks to encourage other nurses leaders to contribute their time and knowledge to the intellectual enrichment of all nurses in Seychelles. Another round of applause, please.
Operated by nurses and leading nurses internationally, International Council for Nurses, the ICN, works to ensure quality nursing care for all, sound health policies globally, the advancement of nursing knowledge. The ICN is the parent organization for All Nation Nurses Association worldwide. Investing in nursing and respecting nurses. Key themes for International Nurses Day 2022. Focusing on the need to protect, support, and invest in the nursing profession to strengthen health system around the world. Each year, the ICN lead the celebrations on International Nurses Day, held on 12th of May, the anniversary of Florence Nightingale's birth. Without further ado, let us hear and visualize the pre-recorded message by the President of the International Council for Nurses, a nurse, Dr. Pamela Cipriano, said, "Nurses, a voice to lead, invest in nursing and respect rights to secure global health." A round of applause, please.
Esteemed guests of the Seychelles, I'm Pam Sabri. I bring you greetings on behalf of the ICN Board of Directors, our staff, and our more than 130 National Nursing Association members representing the voice of more than 27 million nurses worldwide as you come together to honor the courageous work of nurses and midwives in Seychelles. In celebration of both International Nurses Day and International Midwives Day, It is also the perfect opportunity to advocate for the investments in nursing and midwifery that will continue to advance education, research, and practice. ICN's mission is to represent nursing worldwide, to advance the profession and influence health policy. Our goal is to raise the voice of nursing, to lead, to inspire others to take on the challenges, and to inform colleagues, governments, and the public how to make the most of nursing knowledge and a workforce that is critical to any nation's health and the health of its people. International Nurses and Midwives Days are a time to celebrate the incredible acts and impact of these professionals on the health of our nation and the world. The stories aren't limited to one day, but resonate throughout the year. It has never been more apparent now how vital our work is to the lives and livelihoods of the people and communities we serve. The theme for the 2022 International Midwives Day, May 5th, is Follow the Data, Invest in Midwives. And the theme for International Nurses Day, celebrated officially on May 12th, is Nurses, a Voice to Lead, Invest in Nursing, and Respect Rights to Secure Global Health. It is clear investments in nursing and midwifery are vital to healthy people and health equity that can only be achieved by strengthening our professions. These calls for action reflect the urgency to strengthen the nursing and midwifery workforces so that we can deliver on the goals of universal health coverage. The workforce is aging, and with heavy workloads and sustained pandemic trauma, is hemorrhaging both experienced and novice nurses alike. We cannot wait to improve our work environments and increase support for professional development. ICN has been vocal in its call for investment in the nursing workforce to meet healthcare needs now and into the future. We are joined in this call for action in collaboration with many colleagues, and specifically the World Health Organization. WHO's first State of the World's Nursing Report, released in 2020, identified gaps in the nursing workforce and priority areas for investment in nursing education, jobs, and leadership to strengthen nursing around the world and improve health for all. This was followed in 2021 with a report from WHO on global strategic directions for nursing and midwifery, which presents evidence-based practices and a set of policy priorities that can help contribute to ensure that midwives and nurses optimally contribute to achieving health equity and universal health coverage. Policy priorities focus on education, jobs, service delivery, and leadership. Earlier this year, ICN, together with the International Center on Nurse Migration of CGF&S and WHO, published another critical report titled Sustain and Retain in 2022 and Beyond, the Global Nursing Workforce in the COVID-19 Pandemic, which identified clear actions needed to implement the directions and policy priorities of both the strategic directions of nursing and midwifery and the recommendations of the State of the World's Nursing. It's also responsive to the emerging crisis caused by significant attrition from the workforce and calls for governments to guide workforce planning to stem the global nursing shortage crisis. Achieving all of these investments will not be done by nursing alone. It will rely on collaboration and support from many stakeholders who understand that without nurses and nursing care, there cannot be health. What can you do to urge your leaders to invest in the strategic priority areas of nursing? I offer a few examples that support all four areas of education, jobs, service delivery, and leadership. First, work with government leaders to increase investments in education by making sure they have the evidence that shows nurses improve the health system and patient outcomes, and advocate for the capacity to graduate more nurses and encourage nurses to continue their education, including for advanced degrees. You are fortunate to have engaged and knowledgeable government leaders who have joined you today. Ensure the quality standards of practice match the education, scope of practice, and competencies. Develop leadership capacity by mentoring emerging nurse leaders, acquiring key skills in the areas of finance, regulation, and policy development to position yourself to lead. Expand research and evidence to support the business cases for nurses working to their full scope of practice and education. ICN has prioritized two policy areas for investment as well: the safety of nurses and healthcare workers and their health and well-being. ICN stands with all of the world's nurses, and as always, we've been lobbying for your safety, working to eliminate violence against healthcare workers, and making the case for greater investment in nursing jobs, leadership, and education. Our work directly influences the global health agenda. We know we cannot have health for all without a strong, resilient health workforce. Now, more than ever before, we see the unnecessary gaps in keeping nurses safe, either due to inadequate staffing or supplies, or unchecked violence at work in our communities. And the prolonged stress, fatigue, and moral injury from the pandemic have also amplified the threats to well-being for nurses everywhere. We must protect our nurses and other workers. Health workers' rights are human rights, and right now, both are at risk. Nurses have the right to work in a safe environment, free from abuse and violence. They have the right to have access to vaccines and personal protective equipment, the right to adequate and equitable pay and mental health support. ICN calls on governments to fulfill their obligations to respect and protect human rights and to adopt and uphold legislation to ensure equal access to health care, vaccines, and protection, not only within their own countries, but worldwide. We want to see a world where human rights are respected and protected, so we work in partnership to advance the profession and seek to improve the well-being of nurses and all healthcare workers. It's impossible to talk about where we're going without reflecting on the impact of COVID-19, not just the past 2+ years, but also for the future, knowing there are hidden scars and potential long-term effects that nurses and other care workers will carry for years to come. I commend the Nurses Association of the Republic of Seychelles for your vigilance in keeping close track of the workforce and how nurses were redeployed to meet health needs across the islands, as well as mobilized for the vaccine campaign. It's not surprising that you have high vaccination rates, in large part due to the efforts of your nurses. At the same time, we know nurses in Seychelles, as around the world, have suffered, not only for becoming ill with COVID, but also as the tireless workers on the front line caring for very sick patients while rebuilding public health services. We owe a debt of gratitude to nurses, midwives, and all healthcare workers who have given so selflessly to help others. That gratitude can come in our concerted efforts to protect, support, and invest in the nursing and midwives to strengthen our health systems. As we commit to a healthier future, we work together to advocate for workplace health and safety through better education, policies, and procedures that protect workers, research on best practices, and availability of known preventive measures. We work to ensure positive team environments and workplace cultures that provide support to others, as well as maintain our own health and well-being. These are now the mainstay of our work together, to have and retain a healthy work environment and workforce, no matter where nurses practice. Our presidential watchword is influence. It's a power we can leverage to advance the needs of nurses and midwives, as well as those we serve, and convince others to recognize the impact that nurses have on our patients, families, and communities. All of the actions to secure investments in nursing require us to influence others, those who already support us, and those who are in a position to lend financial, political, and intellectual support to our global agenda. ICN supports you in gaining influence at every level, including with the highest leaders in government. Thank you for your dedication, hard work, and sacrifices throughout the pandemic. You have persevered in difficult circumstances, sometimes at great personal risk. You have shown the world why a strong and supported nursing workforce is critical for health. Together, as we look to the future, we will build a more responsive health system that addresses global health problems and improves the health and well-being of all people with a commitment to invest in nursing. I wish you a successful meeting that lifts spirits and restores joy and meaning as you continue to lead and advance nursing and midwifery to promote health and health equity for all. Thank you.
Thank you to Dr. Pamela Cipriano. The theme for the IND 2022 demonstrates the need to invest in nursing to build a resilient, highly qualified nursing workforce and to protect nurses' rights in order to transform health system to meet the needs of individuals and communities and now into the future. May we give her another round of applause. Thank you.
During the COVID-19 pandemic, nurses and nursing throughout have all still and remaining running a golden thread and touch hundreds of millions of people and save countless lives in all countries, including Seychelles. Seychelles, a small island state, is proud of the role to date in ensuring the COVID-19 health response has been effectively managed. This is visible in balancing the health of a nation with its economic well-being, which is a delicate political process, one which the Seychelles government managed far better than many other countries. Having nurses involved in all areas where decisions about healthcare are made, including at the government level, is an essential first step to the success of health system of the future. Ladies and gentlemen, I now have the honor of inviting His Excellency, Mr. President Wever Romkalawan, to officially launch the Symposium for Nurses by Nurses. Please, a round of applause.
On dit bonjour, Mr. Speaker. Bonjour, tout bon ministre présent. Bonjour, Chairman NARS et Patron, bonne nurse. Tout bon nurse, tout bon midwives. Tout bon docteur aussi qui m'ont trouvé, tout bon monde qui est involved dans le service la santé. Il y a aussi bon membre de l'Assemblée qui, à travers les autres comités, donne support. Un grand bonjour et premièrement, félicitations et pour la journée que vous avez célébrée hier et merci beaucoup pour tout ce qu'ils ont fait. Les temps regarde dans la salle, on trouve beaucoup de bonnes figures qui 38 ans passés, les temps ordonné comment ils prêtent et après ils attaché avec l'hôpital comme aumônier. Bonne figure qui m'ont joint qui est Madame Nissette dans le ward, les temps passés, puis regarder lesquels bonnes monde qui l'hôpital. Trop beaucoup de bonnes figures. Et mon oiseau et mon connaît qui vous dit aujourd'hui, il y en a certains parmi les autres qui ne prennent pas de retraite. Mais c'est mon connaît qui vous dit autres lesquels encore battu pour sa profession. Et mon connaît qui vous dit autres encore peut donner conseil qu'il faudrait donner. Et à chaque fois qu'ils ont appelé, ils ont paré pour donner support. Par exemple, on peut dire, on ne va pas un homme tout bon nom, mais plus je regarde, plus moi en même temps, je m'imagine les autres noms. Madame Wao, Elsia, Madame Anderson, Madame. Sans un peu ou non? Madame Chung Fai. Tu connais comment Madame Chung Fai, ça l'état? So, comme si plus je regarde, plus je vois sa bonne figure, sa bonne nom. Et aujourd'hui, je suis content pour voir qu'il y en a beaucoup parmi les autres qui ont encore le front line. Pareil, ils ont été tout le temps. En même temps aussi, les 3 semaines passées, nous avons assisté graduation ceremony, c'est un nouveau groupe nurse, et il bien pour moi certains parmi les autres là. Et sa graduation ceremony, c'est donne nous sa possibilité pour voir ça bon nouveau et où tu sens il y a dans ça l'enthousiasme. Et pour moi qui fait join sa nursing profession, sa caring profession, on va dire avec d'autres courage et bonne continuation. Et Mazine qui vous dit bonne challenges devant, mais pour autres, pour chaque nouveau challenge, comment une façon pour autres avancer devant. L'état mon regarde bonne nurse, bien sûr, bonne nurse, bonne midwives, moi pour tout le temps service à des moments où vous êtes nurse, à cause moi quoi, bonne midwives, je joignent là-dedans, même si votre profession est un peu plus spécifique parce qu'ils ont une spécialisation. Bien sûr, nous pour tout le temps reconnaissants parce qu'ils donnent nous une certaine réassurance. Et mon connaît qui vous dit, c'est celle, les banneuses, je donne nos populations plus rassurance. Spécialement nos banneuses, c'est loin. Mon connaît quand c'est des gens qui disent avec vous, plutôt malwa sa nurse qui mal que docteur. À cause de sa nurse, il plus qu'on côté mon douleur y était, il plus qu'on est côté mon fait mal y était, et ça qui pour dans moi, il pour plus bon. Et parfois, il y a un patient qui sort du côté docteur, les temps autres sortent du côté docteur, les autres viennent côté nurse, ils disent miss, ça y est bon ça qui a docteur dans moi. Et mon connaît vous dit parfois, il y a une bonne nurse avec votre qualification, avec votre expérience. Je dis non, moi c'est pas besoin de penser à elle. Ou bien mon frère s'appelle qui là, vous connaissez ça, dès qu'il donne, nous prenons des signes. Et il dit, vous prenez un beau matin, un soir, pas besoin de penser à un soir, prenez des signes beau matin. Ça, nous l'expérience, c'est celle, et mon connaît qui vous dit, beaucoup de bonnes nurses, souvent de fois, ils gagnent plus bonne considération que docteur. Et dans le canton, dans le district, avant qu'ils aient le côté docteur, parfois, ils viennent côté sa nurse pour gagner un conseil. Mon pays fait ça ressortir simplement pour montrer qu'il y a gagne valoriser. Dis mon y a confiance dans autres. Et à travers sa confiance, ils sauve beaucoup la vie. Mon con nurse qu'il est temps docteur give up le patient, nurse qui ressuscite sa patient et il redonne lui la vie. Mon connaît qui ça n'arrivé le plusieurs instances, spécialement dans casualty. Mon connaît live comment un nurse côté casualty. Mon connaît l'expérience qui déjà passe là dans côté un petit baba, un petit enfant. Le docteur dit fini. Mais seulement avec cette expérience, avec sa connaissance qu'ils ont en eux, il est capable d'aller sauver sa petit baba. Et aujourd'hui, il y a un enfant qui peut continuer à grandir. Mon oise de dévotion. Et mon connaît les efforts qu'ils ont fait. Mon oise la fatigue les autres figues. Mon oise les larmes coulées. Les temps autres patients, les temps autres patients qui ont pensé qu'ils sont capables de faire quelque chose, ils savent autres pareil nous dit et ils sont pas capables de faire rien. Mon oiseau les temps autres console bonne famille côté nous autres bien-aimés, ils disent au revoir. Alors vraiment dans autres comment bonne nurse, il y en a une bonne qualité spéciale. Et c'est pour ça raison que nursing il pas gagne considéré comme un travail. Ou parlons d'un travail comme un nurse. Il y a une vocation. Il y en a quelque chose en dedans qui, si vous ne pas mettre en application, si vous ne pas mettre en pratique, prenez quelque chose qui peut manquer. Et moi, ça dans autres. Alors, je m'envie de dire avec autres, continuez dans ce même l'esprit. Mon courage autres. Et je connais parfois, je ne pas gagner, pareil, médecine dit, parfois je ne pas gagner considéré comme un général. Je ne considéré comme un private, comme un 16 ans. et pas comme un ban général, quand au fait, c'est autres qui ban vrai général. C'est autres ban vrai du monde qui peut dirige ça la masse pour nous gagner meilleure la santé. C'est autres qui là pour diriger autres ward qui sont en sas, pour autres faire sa propre management dans toutes les différentes instances et qui fait quelque chose arriver. En même temps aussi, mon connaît qui peut dire, malgré tout ça qu'ils ont donné, parfois ils n'ont pas gagné sa respect. Ils ont gagné insulté. Ils ont gagné maltraité. Il est quelque chose qui marche bien, ok. Mais il est quelque chose qui marche mal, ils ont gagné maltraité. Et souvent de fois, nous peuples, quelquefois on va dire, nous pas montrer assez reconnaissance pour ce travail qu'ils ont fait. Mais d'après mes beaux matins, là, mon vie avec eux, pas besoin de paix. Pas besoin de paix. Continuez, pratique votre vocation. Et à travers ça, du monde pour apprécier les autres. Sa petit merci que vous avez gagné, parfois sa petit carte qui est patient, qui ne sortit dans sa ward, il n'envoie pour les autres, ou bien sa petit bouquet fleur, prends ça comment ça donne les grains qui pour donner aux autres plus grand l'encouragement encore. Pour ban qui zen, pas besoin de give up. Le premier, l'insulte qui vous gagné. À cause vous besoin d'imaginer. Pour ne pas décider trois l'insulte, pour l'année l'insulte encore. Mais, as long as qu'ils ont continué, faire ça qui est bien, donne tout ça qu'ils ont en eux, c'est là qu'ils ont pour gagner sa satisfaction. Et c'est là aussi qu'ils ont pour sentir, qu'ils peuvent dire, votre contribution envers une meilleure la santé, votre contribution vers redonner du monde, votre la vie et contribution dans toutes les autres instances peut vraiment gagner apprécier. On répond à parole qui ministre Vidot, il dit restez assurés qui pays lui-même, qui gouvernement lui-même pour continuer dans autres tout ça l'encouragement. Et au fait, juste pour montrer qu'il y a importance autorité, avec ça, nous avons fait pension, l'âge, peut monter, ainsi de suite, toi, ben taraka qui aujourd'hui, nous tous nous peut passer là-dedans, qui nous avons content, qui restait même l'âge. Ministre Vidot, il vient côté pour dire avec moi, ben, qu'on est, le perdre quand c'est nos bannes qualifiés. Et aujourd'hui, moi, je dire avec vous, nous avons une conversation qui nous peut faire avec fonds pension pour regarder spécifiquement d'autres professions. D'autres nurses qui nous donnent plus de 35 ans de la vie, plus de 40 ans, pour nous regarder qui nous sommes capables de faire pour eux autres. Nous pouvons discuter et bientôt, il y aura une annonce qui va gagner faire dans ce domaine. Parce que nous ne sommes pas capables d'espérer dire nos bonnes nurses qualifiées, c'est ça cause une question de l'âge, c'est ça cause une question pension. Quand nous avons encore une quantité pour vous donner. Mais justement, pour montrer qu'il nous vraiment apprécier les autres, les autres connaissent plusieurs projets qui nous ont là en main comme un gouvernement. L'école, finalement, nous pour gagner les autres pour l'école. Il y a une construction et on espère que l'année prochaine, ou plus tard, l'école va terminer. La présence de va connaître pour dire ça y appelle pour les autres. Pour n'a pas, pour dire la présence pour bouger, pour aller dans l'endroit, ça y va pour les autres et nous va capable aussi développer ça l'école pour nous mettre le bon standard international. Pourquoi pas pour nous capables aussi à travers sa training qui nous va donner à training nurse dans la région, le niveau de l'Afrique et c'est va capable encore une fois faire une autre qualité contribution. Mon aussi cause le training spécialisé pour nurse. Quelquefois parfois certains a dit que mon pas rien record de rayé. Mais c'est mon content mention de ça. Et parce qu'il y en a quelque chose de concret qui peut faire. Si tu dépends entièrement de nous, ça c'est fini, comment ça arriver. On a parfois les temps où on n'a pas tout de moyens, on peut négocier, on peut espérer, ou gagner un lien l'espoir, et après on peut au début quand est-ce que ça peut arriver. Mais seulement, là, mon envie de dire avec les autres, pareil, il y a des gens qui ont servi, que les appellent clients, mais qui traditionnellement appellent les autres patients. Je dis avec les autres, on a un petit peu de patience. Et quelque chose, il va dérouler, quelque chose, il va gagner faire. Pendant l'épidémie, encore là-dedans, pendant sa pandémie, les nurses ont joué un rôle vraiment, vraiment important. Si tu n'as pas d'autres nurses, le frontline, mon corps pas si nous sommes capables de manager, pareil nous le faisons. Et mon envie, tout le temps, applaudis. Alors, à nous tous ensemble, applaudis tous nos nurses pour ça qu'ils ont fait. Il y en a parmi les autres nurses qui n'ont beaucoup plus loin qu'ils devraient arriver. De la façon qu'ils prennent soin avec du monde, de la façon qu'ils font des masses, de la façon qu'ils mettent pression, de la façon qu'ils prennent soin avec bonnes patients. Et parfois, ça y a quelque chose qui du monde n'a pas réalisé. Qui peut dire, avec sa pandémie, nous avons besoin de faire un certain endroit. Par exemple, étant nous avons sa facilité 40 lili côte Coast Guard. Nous avons besoin de nurses. Mais nurses ou pas, bon Dieu, qui t'y prend la poussière, tu fais même petit chose après, tu souffles là-dedans, tu gagnes là-dedans et kev. Mais nous, ministère de la Santé, n'a pas magique. Qui nous besoin faire? Prendre un ward, côté dans 5 nurses, prendre un ou bien prendre des pour de sa nouvelle facilité, prendre des dans l'autre pour le family hospital. Les faits qui family hospital, il y a un ICU, il y en a tout ça là, nous connaissons qui peut besoin plus nurses. Alors, si vous besoin prendre des encore, 3 là-bas, les temps service, il réduit, du monde dehors, il dit, d'autres complaintes. Et puis, ça, vous pas réalisé qui peut dire, on peut manager. Sa nurse qui t'habite dans son ward d'offre, soudain, ou aller pour dire, peut transférer, puis à la family hospital, ou bien, puis dans sa autre facilité, et tout quelque chose est contracté. Dis-moi une complainte, mais seulement, mon vie, aujourd'hui, dis autres, merci beaucoup. Et en mesure qui dit, mon écoute d'autres conseils, en mesure qui dit, mon prend d'autres bonnes précautions, aujourd'hui, même si de temps en temps, là, il n'arrive pas là aux 500, nous n'arrive presque des 100, un petit guide pas en bas des 100, quelque chose, il fait un petit montée, un petit descendre. Mon connaît qui peut dire, à travers ça, nos services de la santé lui-même, il a pu reprendre. Et différents wards, puis dans sa quantité de nurses qui sont être en an, services spécialisés, c'est aussi tous de pays capables de recommencer à fonctionner avec bon staff approprié. Sur ma vie, 10 autres, merci beaucoup. Merci beaucoup pour votre contribution. Et à travers votre contribution, vous êtes capable de permettre que ces celles, ils réouvrent sur la porte et nous, l'économie, est capable de reprendre. Si bonne nurse partie involve dans sa programme vaccination, et là, moi, sister, au bord moi, qui dirige sa campagne vaccination, si vous partie involve là dans le centre communautaire, pas à tous côtés, pour encourager les gens pour venir prendre un vaccin, pour nous, l'État nous arrive mars l'année passée, pour nous capables, nous arrive presque 70% de nos populations gagnent vaccinées, et là aujourd'hui, nous parlons aux 80% vaccinés, both avec sa dédoseuse et après avec booster, nous ne sommes pas capables de réouvrir l'économie. Et à travers notre contribution, nous sommes capables de redonner l'économie nationale, ça souffle. Nous sommes capables de faire rentrer l'année passée 189 000 visiteurs. Et là, ça en est, sa premier quarter, nous finissons laisser rentrer dans nos pays 115 000 visiteurs. Et ça, il y a un grand rôle qui est là-dedans, rôle primordial. Alors, encore une fois, le gouvernement, je vais dire merci beaucoup pour ce travail qu'ils ont fait et à travers les autres, nous fait tennis à l'économie, permettez-nous pour nous gagner assez l'argent, pour nous envoyer tous nos étudiants qui gagnent un scholarship, pour nous envoyer tout dans différentes universités, pour être capables de retourner pour faire des contributions. Nous sommes capables de donner tout le monde la pays, même si nous ne sommes pas contents, pareil nous tous nos envie qui connaît la pays un peu faible dans le poste, la vie dit, pour la vie de monter, nous sommes contents un petit peu plus, mais c'est au moins là, nous sommes capables de gagner assez pour nous capables de continuer à tenir ça, pour nos bonnes enfants à l'école, pour nos bonnes vieux du monde gagner care, ça qui besoin, ainsi de suite. So, tout ça là, il vient de son base, mais nous connaissons qui vous dit bonne demande peut continuer à augmenter. Donc, je ne vais pas pour plus long que ça, parce que je crois qu'il y a différents du monde qui nous causait avant moi, je suis le côté technique, le côté différentes nécessités et tout. Mon envie, pour terminer, encore une fois, réaffirme si pour qui gouvernement pour donner tout. Dis autres merci pour ce qu'ils ont fait et dis autres continuez. Jouez autres rôle, continuez, donne ce qui est meilleur en des autres et qu'ils ont gagné valoriser. Bon sens, toute bénédiction et courage. Merci beaucoup.
Thank you, His Excellency President, for reassuring nurses and midwives in Seychelles of the upcoming strategy to support their profession to further transform the health of our population in Seychelles. Now we have a surprise for two nursing colleagues. May I ask the President to do the honor to recognize two of our young nurses who have excelled. I call upon Ms. Tracy Didon to come forward to receive a token of appreciation. Give a round of applause, please. Tracy, Ms. Didon has excelled in her studies in IHSS and was awarded Best Academic Performer in the 2021 nursing cohort. Thank you, Tracy. Thank you, Mr. President. So, secondly, we would like to call upon Ms. Erin Simeo to come forward, please. Ms. Simeo. Please, Mr. Simeo. Please give Ms. Erin a round of applause. Ms. Simeo was awarded Best in Practice for the 2021 nursing cohort. Thank you, Ms. Tracy and Ms. Simeo, for your. Thank you, Mr. President, Tracy, Mrs. Vidot, Honorable Bistoke, Mrs. Mordon, and Chief Nursing Officer for doing us the honor. Thank you.
Before we break, cordially invite all participants in front of the building for a souvenir photo. After taking the photo, may I invite all present for a healthy break, and for all participants who registered this morning, we shall resume in 30 minutes from now. Thank you.
The photo will be taken outside the building in the lobby. So join the President with a souvenir photo. Thank you.
It is written, you and I should stand by each other on this ark of many colors, sailing to the Seychelles Isles, a dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart, together with a brave and beautiful heart, taking care of one another through sunshine and rain. You and I should heal each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to this dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart, together with a brave and beautiful heart, take one another through sunshine and rain. I'll be a rainbow in your cloud, just keep looking up. À travers le sol et ses cieux, prends bien soin comme la pluie beau temps. should love each other. It is written, you and I should stand by each other on this ark of many colors, sailing to the Seychelles Isles, a dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. You and I should heal each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to this dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. I'll be a rainbow in your cloud. Just keep looking up. À travers le sol et ses cieux, prends bien soin comme un la pluie beau temps. Should love each other. It is written, you and I should stand by each other on this ark of many colors, sailing to the Seychelles Isles, a dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine should heal each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to this dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. I'll be a rainbow in your cloud. Just keep looking up. À travers le sol et ses cieux, pour bien soigner comme la pluie beau temps. Should love each other. It is written, you and I should stand by each other on this ark of many colors, sailing through the Seychelles Isles, a dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. You and I should heal each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to this dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine sunshine and rain. I'll be a rainbow in your cloud. Just keep looking up. À travers le sol et ses cieux, pour bien soin comme la pluie beau temps. Should love each other. It is written, you and I should stand by each other on this ark of many colors, sailing to the Seychelles Isles, a dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. You and I should heal each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to the dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. I'll be a rainbow in your cloud. Just keep looking up. À travers le sol et ses cieux, prends bien soin comme la pluie beau temps. should love each other. It is written, you and I should stand by each other on this ark of many colors, sailing to the Seychelles Isles, a dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. You and I should heal each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to this dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. I'll be a rainbow in your cloud. Just keep looking up. À travers le sol et ses cils, prends bien soin comme la pluie beau temps. Should love each other. It is written, you and I should stand by each other on this ark of many colors, sailing to the Seychelles Isles, a dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to this dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. I'll be a rainbow in your cloud. Just keep looking up. À travers le sol et ses cils, prends bien soin comme la pluie beau temps. Should love each other. It is written, you and I should stand by each other on this ark of many colors, sailing through the Seychelles Isles, a dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. You and I should heal each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to this dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. Just keep looking up. À travers le sol et ses cils, prends bien soin comme la pluie beau temps. Should love each other. It is written, you and I should stand by each other on this ark of to the Seychelles Isles, a dreamland paradise where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. You and I should heal each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to this dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. I'll be a rainbow in your cloud. Just keep looking up. À travers le sol et ses cils, prends bien soin comme la pluie beau temps. consuelo, la pluie beau temps. I'll take good care of you through sunshine and rain. Yeah. Should love each other. It is written, you and I should stand by each other on this ark of many colors, sailing through the Seychelles Isles, a dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. You and I should heal each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to this dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. I'll be a rainbow in your cloud. Just keep looking up. À travers le sol et ses cieux, prends bien soin comme la pluie beau temps. each other. It is written, you and I should stand by each other on this ark of many colors, sailing through the Seychelles Isles, a dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. You and I should heal each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to this dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. I'll be a rainbow in your cloud. Just keep looking up. À travers le sol et ses cieux, pour bien jouer comme la pluie beau temps. Should love each other. It is written, you and I should stand by each other on this ark of many colors, sailing through the Seychelles Isles, a dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and should heal each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to this dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. I'll be a rainbow in your cloud. Just keep looking up. À travers le sol et ses cieux, prends bien soin comme la pluie beau temps. Should love each other. It is written, you and I should stand by each other on this ark of many colors, sailing through the Seychelles Isles, a dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. You and I should heal each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to this dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine sunshine and rain. I'll be a rainbow in your cloud. Just keep looking up. À travers le sol et ses cils, pour bien soigner comme la pluie beau temps. Should love each other. It is written, you and I should stand by each other on this ark of many colors, sailing through the Seychelles Isles, a dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. You and I should heal each other. It is written, you and I should pray for each other, to hang on till the storm is over. Just a few more miles to go to this dreamland paradise, where the secret of life is everywhere. All you need is a loving heart. All you need is a caring heart. Together with a brave and beautiful heart, taking care of one another through sunshine and rain. I'll be a rainbow in your cloud. Just keep looking up. À travers le sol et ses cils, prends bien soin comme la pluie beau temps. prend soin de vous, la pluie beau temps. I'll take good care of you through sunshine and rain. Yeah.
Trees, nous introduisons, nous causons, nous faisons le travail présent. Nous bannissons, nous faisons le travail. So pour nous travailler, il faut que nous venons devant, nous bousons devant, nous pas un site qui en a devant, il y a une quantité de sites devant. Alors on m'a donné 2-3 minutes, on m'a donné sac, venez bouser, venez devant, parce que là nous avons besoin d'implémenter, qui ça qui nous avec bonne qui fait canter tout ça là bonne expérience qui pour make nous better people de healthcare et nous ca come together l'état y a une pandémie ou il y a une situation très grave qui nous connaît pour dire nous ca négocier jouer domino avant ici avant là-bas et qui ça qui mal massé dans l'état pandémie qui ça qui nous bien fait nous mal fait et nous ca bring tout ça bonne information ensemble hein? Pendant 2-3 présentations, pour qu'on fait, il y a des gens spécifiques pour venir faire une présentation. Il y a important qui présente des take notes. Si vous avez une bonne idée, une mauvaise idée, ou something pour vous exploiter, ou des questions là, nous pouvons besoin faire, ok? So, premier, nous pouvons inviter Miss Evelyn Momo. Il pour, comme elle n'a pas besoin de lunettes pour moi, hein? Il pour présenter le clinical nursing care. Mon besoin de moi, mon besoin de voter. C'est bon, on nous fait une petite practice avant que nous commençons à faire tout ça bonne chose. Nurses qui peuvent travailler in care right now, stand up. In care, peut travailler, applaudissez. Stand up. OK. A round of applause pour vous autres. Well done. Sit down. Nurses that are student nurses or newly graduated nurses, stand up. La nous là. La nous là. La nous là. Well done. Well done. Retired nurses. La nous là. Well done. Well done. Semi-retired nurses, stand up. Semi, allez. Okay. All right. So, Bankin retired, il y a plus de 50 ans l'expérience. So, nous besoin qu'ils ont avec nous, qu'ils ont nous panel, qu'ils ont dans nos comités, qu'ils ont qui racontent nous bonnes histoires qui pour aider nous faire plus bien demain. OK? So, Miss Evelyn Momo, please come forward et faire une présentation. Thank you.
Good morning to you all. My name is Evelyn Momo. I'm an intensive care nurse anesthetist, and I've been working with, I've been assigned with the COVID ICU for the past almost 1.5 years now. So I'm currently working at the family hospital. As my presentation said, nurses response in ward. HDU don't stand for hemodialysis unit, but high dependency unit, and ICU of the COVID-19 isolation treatment center. Okay, to get started, the COVID outbreak by the end of 2019 in China was declared a global pandemic in March by WHO, and consequently a state of emergency.
Really?
Okay.
Okay. Okay.
Correct one. All right. Okay, so I'll start over. The COVID-19 outbreak at the end of 2019 from Wuhan, China, was declared a global pandemic in March 2020 by WHO. Consequently, a state of emergency was declared locally, and on the 16th of March 2020, the Seychelles Family Hospital at Perseverance was converted into the dedicated COVID-19 isolation and treatment center for the country, supported by various other facilities providing isolation measures, clinical monitoring, and/or treatment. The facilities were supported by a Tier 3 facility capable of delivering level 2 IDU and level 3 ICU care that was based at the family hospital. The Tier 2 facility was capable of assessing, triaging clients, and delivering level 1 and early level 2 care. And it was located at the Anse-Royal Hospital, Hermite, Dauphin, New Coast Guard, Baie-Sainte-Anne, on Pralais, or the Tier 1 facility capable of isolating and monitoring asymptomatic individuals were located in Beauvalon Bay, Avani, Southeast Island, Indian Ocean Lodge, and Pension Fund on Pralais, and Villa de Veuve on La Digue. So, the sequence of events that take place once a patient was diagnosed with COVID. The rapid response team will either refer the patient to a Tier 2 facility and upon arrival to the Tier 2 facility, okay, one from the peripheral islands and the local one, it was usually based at the family hospital, the medical officer will assess, and depending upon the evolution of the disease, the patient will either be transferred to the Tier 1 facility for isolation and monitoring, or a Tier 3 facility for specialized treatment, or they will be stayed on the ward where they will receive level 1 and early level 2 care, which meant mostly it was oxygen therapy. Depending on the progression of the disease, The outcome where either patient was discharged or sadly, some died in our facility. Coincidentally, I have heard a lot about Florence Nightingale today morning. So, that same year was designated by WHO as the Year of the Nurse and Midwives in honor of the 200th anniversary of the birth of Florence Nightingale, a visionary nurse and leader who devised the basic strategies of infection control, such as proper hand washing and physical distancing, to decrease mortality rates among wounded soldiers fighting in the Crimean War. These same approaches have today become the principles in the fight of COVID-19. No one could have predicted how fitting this declaration would be in the light of COVID. Now, how were nurses redeployed? In 2020, a total of 64 nurses were redeployed, whilst in 2021, 88 personnel from various clinical settings were to work in one of the several COVID centers, T1, T2, T3 on Mahipral and Ladig. As the number of COVID cases increased, clients requiring HDU and ICU care rose. Okay, and that was at the beginning in months of February and March. As you can see, Zone 3, ICU, the line graph rose in the middle of March, February to March, and to a greater extent in the month of May, June, and July. Afterwards, it goes down. The family hospital transformation at that time into a pure Tier 3 facility took place in the first week of May 2021. Hence, the number of level 1 patients at the facility showed a significant decline. And this is represented by the green line graph. And the reasons for that was because patient was either discharged or transferred to a Tier 2 or Tier 1 facility to continue the isolation and treatment because of the increased number of ICU care patients at that time. The added response to meet with the needs. Rapid induction and refresher courses in both IPC and critical care were organized. Nurses working longer hours and of different shift patterns because of nurse shortages. Bringing non-practicing nurses back into the workforce as temporary or voluntary returners, mostly involved with the vaccines. Deployment of student nurses to frontline works, and they were mostly assigned on Dauphin and Ansoyal Hospital. Our key achievements. We were able to operate an ICU outside of the main ICU at the Seychelles Hospital at the same level and standard. We have very good rapport with different stakeholders, example, the EPR, ICU managers, and the directorate office. We were always pestering them for more staffs. Every patient that nursed back to health was a victory or success. Sadly, whilst I was going to the statistics, from the whole of January 2021 to December, our ICU admissions were 92. And only 35 clients walked out of the ICU alive. On-the-job training for unskilled staff to work in the T3 facilities. Ward nurses were stepped up to provide HDU care. We trained them to be able to connect and disconnect patients to NIV to try and relieve pressures on ICU admissions. Small in-house training by the doctors, further developing our knowledge and skills. Nurses found positive aspects of the pandemic in the support and appreciation received from patients, families, and the community. The pandemic has elevated recognition of the nurse's role in the healthcare system, and the nursing profession has become more visible. Teamwork was a source of our strength, looking after one another from the town we don until we doff and beyond. Now our challenges. Thoughts of getting infected were the uppermost concern for most of us, especially during the early stages of the redeployment, where COVID was still in its infancy. Safe nurse-patient ratios were not observed, not meeting standard of 1:1 or 1:2, which is the norm for ICU admissions, depending on the severity of the illnesses. At one point in June 2021, our ratio even raised up to 1:3 and even 1:4 in some shift, impacting the quality of care. During this time, for the whole month of March, we got 15 admissions. And during that particular period, we had 8 patients in-house. At this time, we were operating 3 ICUs at Perseverance. We were understaffed and working very long hours to cope with staff shortages and increased ICU admissions. In addition, ICU nurses, we have to put our input for patients on NIV at HDU ward level. That was the initial stage before we were able to train the ward nurses. When we come in, usually at that time we were able to get 4 staff per shift. If we started to work in ICU 1, by the time our shift ends, we will be working in ICU 3. That was how difficult and stressful the situation was for us. Teaching of unskilled personnel in a stressful environment. Even though we were asking for more staff, we were given staff, but most of them has not had ICU experiences. So we have to train them to be able to work safely in the ICU. In the initial phase, it was also difficult for us to get healthcare assistant help. We had to give total care to the patients by ourselves. But later on, we had a meeting with the management. This is what was important when the grassroots met with the management, because they listen at times, and things were sorted out. The additional responsibility of changing oxygen cylinders, it was our burden as well, because there was no porters in Perseverance. ICU nurses have to change we have to plant the left and right, and each plant can operate 4 cylinders at one time. When the oxygen completed, it will trigger an alarm and shift to the other bank. So the ICU nurses have to go there to change those oxygen cylinders day and night. And when we were at the peak of the surge, we have to do it every 90 to 120, 1.5 hours to 2 hours. The disturbing plight, I'm sorry if I might cause some pain to some people, but this was what we go through. The disturbing plight of patients dying alone without their loved ones around them, and making the last devastating phone call of their passing away, and listening to the recipient's reaction of the news. Helplessness felt among staff. In spite of their best effort, some patients died. It felt like we were failing. The patients were so sick. We were unable to make them comfortable, and witnessing the constant struggle and decline in the patients was very stressful and heartbreaking. The most haunting and morally distressing task of telling the patient Sometimes you feel that you were lying to them, but that's part of the job. We were going to help you get better by putting you on a breathing machine, but deep inside, unaware, unsure if they will ever come out. Listening to patients begging you to help them get better fast so that they can go and take their vaccines, or telling you to tell their family that they loved and missed them. Staff were petrified to go home, worried about infecting their loved ones. Stigmatizations by colleagues and relatives alike in the early phases. The lack of adequate resting place, especially during the surge. The main reason for that was because the staff allocation was circumstantial depending on the amount of admissions. And the facility could not cater for the amount of staff, to provide resting place for the amount of staff per shift, especially at night. Limited privacy for patients, non-conduciveness of the facility for the mentally challenged clients. The unending impact of COVID-19 in a survey conducted in the US, nurses expressed that they will be forever changed by the events. We can't unsee what we have witnessed. It stays with us, and I know I will never be the same person again. This was extracted from the American Journal of Critical Care, Volume 31, March 2022. The way forward and recommendations. We believe that we should facilitate protected visitation, at least one family member, and or make available the use of technology so that the family will be able to see their loved ones while they are being informed of their condition. Arrange a pastor or priest to get involved. As a Christian, it was very difficult watching people to die with no due respect paid. Refresher training on IPC practices to update staff on new evidence. Refresher course on patient-centered care. Develop more training in critical care. Conduct of team building exercises. Develop proper stocking and ordering mechanism to prevent shortages of important medications and consumables. Provision of specific equipment to help with the ICU care of clients. A lot of our admissions were obese, even morbidly obese patients. Special hoist and sliding sheets or part slide to assist in positional ventilation, including prone ventilation. Deployment of various cadre of workers when the need arises. A separate room for the critically ill, apart from the main IDU or ICU, for especially those in the terminal stage to prevent the psychological impact to other patients admitted to the unit. On a final note, I will suggest that as we go ahead to the new normal, before the redeployment of staff to the normal working environment, it is very important to allow the staff to debrief via informal group discussions and to utilize other coping mechanisms. Several studies have described workers missing colleagues and struggling to engage with previous work. Others mentioned feeling isolated because the only people that they felt they could really talk to and who understood what they were feeling were the people with whom they were deployed with. On our part, we designed this questionnaire, and my plan was to get as much of the working staff who has had experience in perseverance to fill it in, and I was hoping that today I might have something to present to you. Sadly, the feedback I got, the response I got were not significant. It was even less than 1/5 of the staff, the total staff. So we have not given up. We are still issuing those questionnaires so that we can understand the experience of the nurses who have worked in perseverance and possibly in future forums, we will be able to present our findings. Thank you.
Thank you, Ms. Evelyn Momo. Et quelque chose qui on apprécie avec lui, il vient avec tout son constant et il vient avec tout son recommandation aussi. Et son transparency pour montrer pour dire c'est difficile. COVID c'est vraiment difficile pour lui et pour tout le monde et les gens qui peut travailler avec COVID. Et il y a nous qui perdons famille ou des gens qui nous dans l'état COVID. Et nous avons une grande appréciation pour les gens qui travaillent avec des gens qui ont COVID. Et c'est quelque chose qui nous apprend et nous avons besoin d'implémenter. Et c'est moi, s'il y a des gens qui ont quelques questions pour Ms. Momo, avant d'y aller, pour nous move on to the next topic, résoudre la même. Oh, nous avons réservé pour panel. So, Marc, les autres questions, nous avons réservé pour panel. Merci beaucoup. Donne-moi appréciation pour ce qu'il fait. Vraiment, il est important pour nous voir l'autre côté, qui m'a dit mon travail, qui m'a dit mon step up, et qui va construire nous gagner, et qui va quelque chose. À cause COVID, nous avons gagné l'autre outbreak of something, et nous avons besoin qu'on ait meilleur pour groupe et faire beaucoup plus bien pour nous fellow members de nos sociétés. All right. Là présent, il dit mon qui call round the clock. The leader, ça 16 ans dans vaccination programme. Madame Bijou. Pour Madame Bijou, une réponse à ma question toute la journée. Quand mon peux aller, quand mon peut donner un vaccin, ou besoin de moi, pas besoin de moi, un Bijou présenté. OK? Allez. Allez.
Morning to you all. I'm going to present the vaccination campaign. Okay, for the introduction, we're going to talk about the justification, the aim and objectives of the program, the milestone, the human resource development, challenges, issues, and recommendations. So justification to the campaign. In December 2019, COVID-19 was detected in China. A novel coronavirus, SARS, was identified. In January 30th, 2020, WHO declared the outbreak of public health emergency of the international concern. And on the 3rd February 2020, WHO released the first strategic preparedness and response plan. February and March 2020, Seychelles developed the first national preparedness plan in response to prevent and respond to the introduction of the imported cases into the country. And on the 14th of March, the first case of COVID-19 was detected in Seychelles. So in October 2020, the API program and other partners initiated preparation for the national vaccination campaign. And the National Technical Committee, comprising of 3 senior nurses, was set up. And on the 10th of January, we launched the national COVID vaccine campaign by the President of the Seychelles. And the launching activities was spearheaded by the nurses team. And the aim and objectives of the program, the vaccination program, was to protect the integrity of the healthcare system and the country's critical infrastructures, to reduce morbidity and mortality related to the COVID-19 disease, and to reduce the transmission of the virus within the communities. So this is a milestone. We started up in January 2021 with Sinopharm. We introduced the Sinopharm. And the 26th of January, we introduced the Covishield. May, we introduced a Sputnik. And in September, we introduced the Pfizer, started with the adolescent. So for the human resource development, the campaign for general population, we started with 10 main teams were set up. 8 was on Mahe, 1 Lading, and 1 Prale. And the team comprises of 70 nurses, included those from private sector and those nurses retired. We had 20 student nurses. We had 10 medical officers and 29 supportive staff from allied and healthcare assistant. So each team was led by a nurse with clear term of reference. And for the other nurses of that vaccination site also has clear term of reference and SOPs to follow. And we had a core team comprises of 3 senior nurses who coordinated the national campaign. And the core team leaders had final responsibility for implementation of all the activities related to the COVID-19 campaign. The role of the core team was critical for the successful outcome of the national campaign. And the roles and functions were as follows. So we have to plan and coordinate, recruit a human resource, training, prepare training plan, recruit facilitators. We had to procure logistic and service delivery, organize vaccination for specific priority groups, information and communication, as well as monitoring and surveillance and evaluation. Again, in regards to human resource development, the vaccination team for adolescents, as we said in September, we started to conduct vaccination for the adolescent. And those adolescents was aged 12 to 18 years. And we went to 27 educational institutions, 17 secondary schools, and 10 post-secondary schools. And 10 teams led by the nurses were set up to conduct vaccination at the schools. We had about 41 nurses at that time were deployed, 14 students, 10 medical officers, and other supported staff from the schools. And these were the vaccination sites that we went through, all the vaccination sites. Achievements, we managed to immunize close to 200,000. We gave 200,000 injections. This includes first, second dose, the adolescents, Sinopharm, Covishield, and Sputnik. And the coverage for the first and second was above 85%. And for the third, it's only 38% for the third. And for the adolescents, it's around 70% coverage. So the achievements, we managed to have videos, information flyers, developed SOPs. Talks were carried out mostly by nurses. We managed to have one-to-one counseling, and the program was a big success and highly recommended by international media. And to note that most of the flyers and SOPs, the videos, these were conducted and carried out, prepared by the nurses. We had to strengthen collaboration between national and international partners. We had international partners, provision of vaccines and syringes. Local individuals and companies donated supplies such as water dispensers, provision of chairs, tents, donation of money for National Trust Fund. We had Air Seychelles and Zile who helped us to transport the vaccine to the island. We also had transport from Ministry of Education, NI, Finance, and Audit. They helped us with the transportation of the staff. Local governments for the venues. We had Red Cross, IDC, Police Department. All these partners collaborated with us. Other achievements, nurses were being passionate in care delivery and adhere to holistic approach in the nursing. Some success stories reported, like hearing impairment clients were referred to audiologists, counseling and advice of clients suffering from chronic conditions. We had counseling advice for childcare. Clients were highly supported and even immunized on the couch when necessary. Those that was afraid of vaccination, they could not sit down, so we have to support them. We developed a sense of duty. We had some challenges. The cold chain capacity was not adequate because we had to borrow a container to put our vaccines in because the capacity that we have right now is only for the routine. We were not prepared for the campaign. The activity was very hectic. Nurses had only 15 minutes lunch break, and they have to work long hours, 7 a.m. to 7 p.m. in the evening. Poor staff welfare, example, provisional lunch, we started well, and then in the middle of the campaign, nurses were not given lunch, so they have to sort out their lunches themselves. So, lack of human resource, we didn't have a logistic person. We had to set up sites so we have to do it ourselves. So all these activities were performed by the nurses. Managing crowd, long queues, limited time to prepare for the campaign. We didn't have enough time. We started, but we didn't, in the middle of the preparation, we were told that we have to lunch, so we just have to lunch. Setting up of sites, the manager had to take up this responsibility. New vaccine introduction with dynamism of virus and information given to the public had to be updated frequently. With each new antigens, we have to develop new SOPs, organize training and conduct training. We had a communication thematic group at that time, but they was not active. And the core team has to prepare radio message, which should be responsible by the communication team. And of course, staff was very exhausted. I wouldn't say they were tired, but exhausted. Unprofessional security staff and skills workers, no notion of handling a campaign. Sadly to say, some doctors perform just a passive role. Attendance to second dose, most of the time, was a big, we have to sort of trace. The client came for the first, and then when it comes to the second, we have to look for them. We had the anti-vaccine campaigners. Some health staff involved in campaign did not believe in the vaccine, so themselves did not take the vaccine. This was a challenge because when you want to believe in, and when you are doing a campaign and you not believe in that vaccine, so how can you sort of encourage people to take the vaccine? So religious belief, certain domination advise congregation negatively. So these were the issues. Working condition not in line with PSO labor law for the nurses. The nurses worked over 50 hours per week, and they were entitled to be paid only 60 hours per month, and no option to stop after 60 hours. You have to carry on, even if you have exceeded your 60 hours. So we've got extra hours pending since January 2021. I'm not sure when the extra hours will be paid to the nurses or given the extra hours for them to rest. We don't know when it will happen. Overtime payment for allied work was from 96 to 150 rupees per hour, compared to that nurses who had they had to 60 rupees per hour. And nurses that was working outside the Ministry of Health, they had their hour of pay was 107 compared to those in the Ministry of Health. There was late payment. People did not get their payment on time. Staff did not have the opportunity to rest until today. They didn't have the opportunity to rest. So this is a summary of the overtime payment for staff in vaccination site. When you look at for the nurses working in the Ministry of Health, including all the cadres, it can be staff nurse, senior staff nurse, nursing officers, program managers, they've got 60 rupees per hour. Okay? And when you look at for allied, there are one dental therapist. Their overtime pay is 3 times higher for the nurses. And even the ward assistant, they got more than the nurses. So this was an issue, pertinent issue that we think we need to take this up as soon as possible. And the recommendations that we need to improve the cold chain capacity. We need to reintroduce a cold room for adequate cold chain capacity. Introduce fee for replacement of vaccination document, because initially when we printed 70,000 vaccination card, and we haven't reached 70,000 people. We've already issued 70,000 vaccination card. We have to replace because people keep losing their card. Overtime payment for nurses should be according to the PSO. And keep remuneration, working conditions in line with the PSO and labor law. And we feel that the nurses scheme should be revised as soon as possible. So thank you very much.
Who's next? Who's next? Hello? Travail là, hein? Moi, me rappelle, l'état moitié d'un vaccin. The only thing I could describe was that I was hot. There was no fans. And if there was a fan, I manipulated it. So, menopause. Merci, Madame Bijou. So, non, que tu travail pour faire, hein? Yes, non, que c'était le vase pour faire pour, premièrement, un salary gap. It's not fair. Si tout nous qui peut, et we sign consents. We were brought in and we were signing consents when that could have been a logistics. And the consent and stuff. We were brought in and we signed consents and gave vaccines. Anyway, more questions to be asked. So the next presenter is Grita Jean, IPC nurse. Welcome.
Very good morning again to you. And I will be giving a presentation about nurses leading IPC amidst the COVID-19 pandemic. And to start off, I'll just give you a brief introduction about the unit itself, how did it come about. And as you can see, there has been renewed efforts to firmly institutionalize the Infection Prevention and Control Unit in Seychelles since 2010. And the unit falls under the ambit of healthcare agency only. And from there, in 2010, the IPC committee was relaunched, and they had to identify 48 IPC focal persons in the public health facilities only to assist in the program. And within the IPC focal persons, that first 48, they were all nurses at the time. And to note that the IPC committee and the IPC focal persons, they play an important role in the oversight and implementation of a successful IPC program. And currently, the IPC committee, again, was relaunched during the pandemic, and it has 17 members, and we have different cadres, nurses, doctors, and also we have newly got people from the private healthcare facilities as well to join. And with the emergence of COVID-19 pandemic in 2020, the IPC unit itself was revamped. When we say revamped, we had new members joining the unit itself, and including me as well. And we were here to assist with supporting the program and also in the response of the pandemic. And we also received assistance from other nurses ad hocly to assist us with healthcare worker risk assessments and even case investigations. However, with the pandemic, as you know, it's a national health emergency, we had to find ourselves extending our services from the public sector to go to the private, non-healthcare settings, and also to the different health facilities. And with that, we found that we had to now get more focal persons to assist us in enabling to do IPC work within these different settings. And we had to identify other IPC focal persons, which we got 92 from all together. We had from the PHA, we had 64 from the healthcare agency, of all, again, majority of them were nurses. And we had also 6 from the private health facilities, of which also they were all nurses. And we also had an IPC link nurse who were providing oversight on the inner islands for us. And she did a tremendous job during the hectic pandemic period. However, she had to resign late last year. However, currently right now, the program is being made by 2 nurses, me and Miss Rhonda, since May 2020. A successful IPC program in healthcare facilities are based on understanding of what IPC is. And for nurses, healthcare workers, even the managements and the IPC focal persons, to be able to understand IPC and to identify healthcare facility problems or needs, and to prioritize the activities and also how to use their resources effectively, they need to know what IPC is. And as you can see, IPC is a scientific approach with practical solutions that are designed to prevent harm caused by infections to patients and healthcare workers. It is grounded in principles of infectious disease. As you can see now with the pandemic, it has shed so much light. It is grounded also in epidemiology, social science, and health system strengthening, and rooted wholesomely in patient safety and health service delivery. And it is also to note that it is effective in the cornerstone of epidemic prevention and management as well. So this is why it is important that we were part of the preparedness and response during the COVID-19 pandemic. It helps us realize that during an outbreak and during a public health emergencies, it has brought IPC in the forefront because COVID-19 was something that was new. There were so many misinformations going around. How is it transmitted? People were scared. We had difficulties of staff to actually participate in some of the trainings because they didn't want to be redeployed. So it was a challenge, I would say. And you can see that a public health emergency brings about many challenges. The more a health system prepares in advance, the better the ability to respond and for us to adapt with the situation. And when there's preparedness and response, which is a really good integral part of the healthcare system strengthening, it helps us to manage risk that are caused by a pandemic. And IPC, for having been in the forefront of all of this, it helps to prevent and control transmission by implementing the 5 IPC strategies. The 5 IPC strategies implemented by IPC was declared by WHO, and it helps to, as we can see, prevent and control transmission. And the 5 IPC strategies that were firstly implemented were ensuring triage, early recognition, and source control, meaning isolating cases and also suspected cases, applying standard precautions for all patients irrespective of their infectious status, implementing additional precautions. This is where we applied precautions on how COVID-19 is supposed to be spread. We also had to implement administrative controls, which developing guidelines in terms of how the work should flow, how the environmental should be designated, and also in terms of engineering controls, physical distancing, ventilation. All of these were primordial. So to achieve our goal of improving and reinforcing IPC practices during the outbreak, to help strengthen the health system and also to prevent further transmission, our aim was to achieve the highest level of effectiveness in the response of COVID-19 outbreak using the 5 IPC strategies that I have mentioned. And our objectives were to reduce transmission of healthcare-associated infections, to enhance the safety of staff, patients, visitors, and people within the community, to enhance the ability of the Ministry of Health or healthcare facilities and the community to respond to an outbreak, to lower or reduce the risk of the hospital or healthcare facility itself from actually becoming the amplifier of the outbreak as well. And the outcome was to strengthen IPC in the healthcare system, in the community, and to reinforce their capacity to implement and sustain IPC measures. The target groups for capacity building, which was one of the major activities within the pandemic for IPC in terms of preparedness and response, the capacity building was endless for different cadres of staff. We had trainings for all healthcare workers in public and private. We had even for healthcare facility managers also in the public and private. And the trainings that we were doing were also relevant for non-healthcare workers or even entities assisting in the national response. Example, we had tourism establishments, we had army officers who were helping at the time, we had the port of entries, Air Seychelles who were doing repatriation of our patients who were stuck from India, we had the schools, and we have other also NGOs who were also assisting. So the actions planned for the outbreak in terms of IPC were to promote swift containment of the outbreak, but we know that we had challenges with that. But the first thing that we did initiate when the pandemic was declared a public health emergency by WHO, that we initiated IPC healthcare facility-based trainings. So we grouped ourselves with our predecessor, Sister Anne, me and Ms. Rhonda. We went to all the health facilities and the units, and we trained as much nurses or other healthcare workers in terms of the rational use of personal protective equipments, the donning and the doffing process, which was an integral part of the training for healthcare worker protection, proper hand hygiene techniques, and when the moments that they need to do it, and also what is COVID-19 and how it is transmitted. From there, we constituted the first field rapid response team. So we were part of the first team members, and we also provided trainings to the following rapid response team members because we wanted to enhance coordination, operational mechanisms for early outbreak detection and investigation. And we did investigations also, not just on Mahe, we did in time of the pandemic, but to Pralin, Ladig, and even outer islands when there was an outbreak. We also assisted in developing different SOPs, not just for healthcare workers within the Ministry of Health, to ensure that there is consistency, quality, and uniformity in practice, but we also assisted different non-healthcare facilities to develop COVID-19 SOPs, guidelines, and also IEC materials such as posters. And we also developed IPC monitoring tools for the healthcare facilities and non-healthcare facilities, because we were also just not monitoring IPC practices within that different areas, but we were also monitoring IPC supplies in terms of PPE availability, hand hygiene supplies, cleaning supplies, to ensure that there is effectiveness on the program and that the country was ready also to reopen its borders during that time when we visited the non-healthcare settings. And there were also new PCR labs that were being opened. We had private testing sessions. We also provided our support in their designing their infrastructures, providing trainings to their staff, and we were ensuring that they were in conformity with the IPC practices as well as with public health authority principles. During the pandemic also, we had to identify additional IPC focal persons, like I said, and we built their capacity with extended roles, especially in terms of leadership, because we wanted them to take the lead in their health facilities in terms of IPC, because COVID was causing havoc in all the health centers. Health centers were being repurposed for different purposes, like testing stations or isolation facilities, and we wanted to have people on the ground monitoring the day-to-day activity of IPC. We also collaborated with other outbreak response pillars to promote and support IPC and public health measures, and we created public awareness programs with the risk communication and community engagement team. We did press conference, we did talk shows, TV spots, filmings on how to don masks, how to remove, how to perform hand hygiene. And we also went out to the community, did outreach programs to ensure that we are reaching the people and they are understanding what is IPC and how best they can protect themselves and their families. We also built the capacity of all healthcare workers and prepare them to deal when there is, in case of a surge. And we received assistance with the case management pillar for us to be able to do that. It was a very big group. We also assisted in setting up triage stations at the different health facilities and even prepared facilities to serve as testing stations, quarantine, and isolation treatment centers. Most prominently, we did supportive supervision in healthcare facilities and performed healthcare facility assessments, especially in healthcare facilities where there was an increase of healthcare worker infections, and we provided them with tailor-made plan of actions to strengthen IPC in their healthcare facilities. Because what we want, we don't want the healthcare facility to become an amplifier, and we didn't want that the virus itself extend beyond the health facility as well. We also established healthcare worker protection strategies by conducting healthcare worker risk assessments as soon as we had healthcare workers who were exposed, especially those that were working directly in isolation and quarantine facilities. And we did case investigations when we had our first healthcare worker infections in November 2020. And we have instituted surveillance testings for staff, syndromic surveillance and screening, and ensuring that stockpiling of PPEs are available and for use within or without a surge. Sorry. The figure represents here the percentage of the different cadres of healthcare workers that we have trained since 2020. And as you can see, the blue line, nearly the half part of all the trainings done, majority of these are nurses, and 48% of them have received trainings according to the 5 IPC strategies. And we repeated those trainings around the island, in Seychelles, Praia Ladi, given Mahe to the different cadres to help them in responding to the pandemic itself. And we also additionally did trainings in terms of PCR sampling, because now we were extending the roles, especially of our nurses and other cadres of staff, not just the doctors to do the PCR sampling or antigen sampling or serology at the time, but we're extending it to other healthcare workers. So we train them on how to do that, and also on packaging and transportation of sampling as well. This graph here is representing the percentages of non-healthcare workers that were trained also in the preparedness and response of the pandemic. And their trainings also were tailored according to 5 IPC strategies. And you can see that we covered quite a few of entities within the government and even outside as well to assist in the response. So I would say one of our biggest achievements is that IPC has come into the forefront and has been more valued and appreciated within the pandemic. And when we look at our statistics, we have trained over 80% of healthcare workers in IPC in the context of COVID-19. We have been able to penetrate and make an impact within the private and non-healthcare settings, whereby we have now IPC focal persons in private facilities, which before we didn't have. We even have an IPC committee member in the private facilities. And the community now knows what is IPC, not the technicality, but in terms of protection, what we can do, it is more prominent now within the community. And there is established and functional triage station and treatment centers to promote early recognition and also source control in the different regions. And we also, healthcare facility assessments have been performed to ensure that we are monitoring IPC compliance and that our healthcare facilities are ready to deal with the COVID-19 pandemic as well. Another key achievement is that within all of this pandemic, all the hectic time, we had the time to also nurses leading the team to develop guidance documents. So we have developed the National IPC Guidelines 2021. We have also developed the IPC Strategic Framework 2001-2025 to guide our practices. We also have updated the COVID-19 SOPs and guidelines, healthcare worker infections management guidelines. We also had nurses assisting to develop these guidelines. We're part of the core technical working group. So it has been a great achievement. And we have also developed key performance indicators to guide our performance and our improvement actions. And when we talk about also healthcare worker infections, we also have a populated database which is updated, and we monitor trends of infections of different kind of healthcare workers so that we can improve healthcare worker protection as well as provide improvement efforts in the different units and facilities. There are many challenges, but most of the prominent ones within the pandemic situation were in terms of resources, and the first one were human resource. Our unit, as you can see, with the extended roles that we had to man during the pandemic, it is just 2 of us. And we have to manage the hospital, the current hospital, the community health centers, and with the increased opening of other treatment centers, now we don't have quarantine, but other treatment centers, this has created a challenge because we have to make sure that we try to reach all the health facilities and monitor IPC effectiveness there. In terms of materials, there were inadequate distribution sometimes of IPC supplies to certain healthcare facilities or units, which were affecting the implementation of IPC protocols. Example, simple like hand towels for proper hand hygiene, cleaning, disinfectants for cleaning the environment. So these were some of the, and we're having PPE that were of not good quality as well, and we had to step in to intervene in terms of that. And in terms of infrastructure, as you have seen, even when Ms. Mumu was talking, they had also some issues with the infrastructure. Most of our infrastructure here were not ready or built to deal with such a situation that we are finding ourselves in. And for us to be able to ensure that we are keeping our healthcare workers safe and nurses are working in a conducive environment, we had to mitigate so many health facilities. Sometimes those that were healthcare facilities, some were even non-healthcare facilities, and we had to transform them into a quarantine facility, a testing station, to make sure that the healthcare workers can practice safely within that. And in terms also of another resources, the unit itself does not have a dedicated budget, which sometimes make it difficult to implement certain activities, and we depend highly on donations and external support. And within the pandemic, we had to depend a lot of our resources and trainings with the WHO. And also when we look at our network of focal persons to champion IPC in their respective units, their term of reference sometimes is not consistent, because you might have trained them with all the necessary requirements, and then due to they have to change location, or due to an activity or program that comes up like vaccination, or they have to assist or transfer to another health center to assist in the response, you kind of lose them and have to find another one and retrain again, which takes a lot of time. And they are also not being allocated with the dedicated time to perform IPC activities. And we understand some of that because most of the focal persons really are nurses, and they are doing multiple roles and activities in their health facilities. And there are no incentives as well, and when there is, it is too meager as well. And another challenge or gap that is healthcare worker infections, and it is on the rise. And we have also, and when we look at our data, nurses are the most affected cadre in terms of infections with COVID-19, and even reinfections twice, even thrice as well. And healthcare worker behavior, which is also affecting a little bit and leading to poor adherence. So when you look at a recommendation, at a national level, the ultimate responsibility lies with the Ministry of Health. And we would like that the IPC unit becomes a national program with a program manager and dedicated staff. Because right now, though we have IPC focal persons within the private, we cannot actually really bring them to task if they are not performing according to IPC standards. If it was a national program, we'll be able to engage them and be able to prevent infections between health facilities and also extending to the community. Strong recommendation to have full IPC focal persons in hospitals of 100 beds, because we found out during the COVID-19 pandemic, the Seychelles Hospital, the Northeast Point Regional Health Hospital there, and the Inner Islands, especially, there was a big rise of healthcare worker infections, as well as cluster of patients. And if we had had somebody there monitoring the day-to-day, it would have been easier to not have have a hands-on, rather than now escalating to what it had become. And also to have clusters or regions of IPC focal persons to assist in it. And if the IPC focal persons in the different units can receive dedicated time to perform the IPC activities and train staff, and also sustain the newly appointed IPC teams. Now, each unit and health facility has a newly appointed IPC team to try and ease a little bit of the responsibilities that we have given to the IPC focal persons, so that they can provide support. We also don't have a quality assurance and patient safety program, and it is something that needs to be established to support effective IPC program and quality care. And also, in terms of healthcare worker protection, within the COVID-19, there had been different situations of who manages a healthcare worker when they are being infected or when they are affected with COVID-19. And we need to have a multidisciplinary and a multi-sectoral collaboration for effective healthcare worker protection, inclusive of health and safety, occupational health and safety, even the HR. And our infrastructure as well, it needs to be according to standards, so that it can be conducive for our healthcare workers to work in during a pandemic if it ever happens again. Today it's COVID-19, but tomorrow it could be something more serious that could be life-threatening. And in terms of how to change behavior, if we had the IPC focal persons fully committed, they could have used the multimodal strategy, which they know what they are, to assist in achieving behavior change to promote IPC in their facilities. And if also the term of reference could be extended to 5 years, so we don't have to change different IPC focal person all the time. So just a take-home message, IPC should not be sporadic or an afterthought, because it can help to protect you, protect your patients, and protect your community and family as well. And as you can see from the picture, as I end, we have different situations or instances where our nurses were leading during the trainings and also participating in IPC trainings as well. Thank you.
C'était l'information, hein? Hey, sorry, nous pouvons run ta. Si vous les débouter un petit coup pour un peu de l'eau, il y en a l'eau, la table. Sustain you guys, donc on a un petit peu de travail pour faire, mais c'est moi là, Miss Lindsay, ou venir vite na causer, and then we'll have the panel, and then we'll write down the recommendations, and then we'll be done. So, everybody stand up for 10 seconds, stretch, tap les pieds again, okay? Okay, okay. Allez, maintenant, stretch again, bouge les pieds. Nous parlons de divitis, hein? So, nous bouger. All right. Bouger, oui. Allez, Miss Lindsay. Allez, vite, hein? Allez,
oui, oui. Oui.
Okay, merci.
Ok, kan mettre. Ça qui là, hein?
Ça, yes.
Are you sure?
Good afternoon. My name is Nicole Flowe. I will be representing on behalf of Euromedical Family Clinic our experience during COVID-19 response. The content, an overview of the Euromedical Family Clinic, COVID-19 response, deployment of staff, groups targeted, statistics, challenges, COVID-19 experience, recommendation, and innovation. The clinic started operating in October 2011. It has 3 clinics, 2 pharmacies, 2 PCR testing stations. Service offered as followed: adult consultation, pediatric consultation, laboratory diagnostic, and pharmacy services. We have 41 members, staff, including from administrative staff to frontline staff, which include 13 doctors and 7 nurses. The aim: to provide a high standard of multidisciplinary personnel-based healthcare. Specific objective: to provide continuous health services that meet the needs of all who access them. Outcome: to maintain and provide personalized healthcare services to the Seychelles community and visitors. This is a table which shows the staff deployment in our 3 branches and the pharmacies. The groups targeted whilst working with the pandemic, our community, walk-in patient, tourists, and foreign workers. This is a statistic of how many antigen tests and PCR tests we did in 2021 until 2022. Till date, we have 65,135, but it's both of them. But this, it's more specific. The purple, it's for rapid antigen test, and the orange PCR test. And below you can see that since January 2022, it has a decrease in PCR and it's more antigen. Our PPEs used in 2019 till 2022. The yellow one is for face masks. The green one is for disposable gloves. And the purple one is for disposable gowns. We have a peak in 2021 with the more transmission and infection. Challenges we face: ensuring quality care whilst maintaining social distancing and limiting contact with patients, implementation of guidelines and requirements, working in PPEs, implementation of social distancing, health education, and raising awareness with the help of displayed educational material. COVID-19 experience: adjustment in working hours from 8 hours to 6 hours in 2020 with the first lockdown with our free patient. Diverting suspected cases to government testing station before February 2021. Working hours 6 to 8 in PPEs. Keeping up to date with changes in the safety regulation of Ministry of Health and WHO. Close collaboration with Ministry of Health and other private clinics. Access to services by appointment only. Strict implementation of hygiene within all facilities and among staff. Triage, online research, and continuous medical education. We firstly opened our PCR station at Eden in February 2021. Innovation during the pandemic: digitalization of certain services, which include online booking and delivering test results via email, decentralization, increased location of facility to facilitate access to services. We had one PCR station at Eden, and we had to move one to Bovaro. Provision of new services: PCR testing, laboratory services, willingness to provide services along Ministry of Health, investment in up-to-date healthcare services for our client, provision of on-site antigen testing from September 2021, which is the flow of the service. Recommendation to achieve better results for future crises: continuous training in communicable disease, transmission for all staff in all cadres, psychosocial support for staff, more support and help for healthcare workers, protection of their welfare and that of their families, provision of vitamin and supplements for healthcare workers, medicine that they have to buy even though they are frontliners, more healthcare education for community, overwork issues due to lack of staff being infected, addressing burnout in healthcare workers. As Florence Nightingale rightly said, let us never consider ourselves finished nurses. We must be learning all our lives. Thank you.
Rosie. Thank you, Euromedical, pour cette présentation. Dans un petit case study, nous on our apologies from Miss Brisson. She couldn't be here. So Mrs. Bistoke in improvise, in fait un petit case study, I read quickly. Ma autre question, once nous panel monté pour demander après nous bonnes recommandations. The outcome of all this is that we have specific recommendations pour nous cope avec ça qui peut arriver, ok? Yes, sister qui lit un case study, so mon besoin lire, ok? Pardonne-moi. ashamed of her actions, fear of being disgraced by her mother, teacher, and humiliated by her schoolmates or friends, and more agonizing would be the fear of being kicked out of school. She knows she could not mention the name of the father of the baby because Ashley was married, happily married, eh? As they never met again after the one-night stand. She hid her pregnancy until the last minute before delivery. Being a primate, she delivered her baby at Victoria Hospital after reporting with ruptured membranes at Bethanton Hospital on the 30th of November 2021. Cheryl was transferred to antenatal ward at Seychelles Hospital. Upon admission, she tested positive for COVID-19 and had to be admitted in the isolation ward with no visitors. Cheryl was not vaccinated against COVID. According to her, she was hesitant to take the vaccine as it may have negative effects on her baby, though she was counseled by the school health nurse, but there was no follow-up. However, she took the consent form, being a minor, but did not hand it over to her teacher, though her mother had endorsed it. She delivered a baby girl of 2.5 kgs through C-section due to failure to progress. She stayed for 15 days on maternity ward before being discharged for the baby to be observed for weight gain. During her stay, Cheryl was depressed, had difficulty to breastfeed. Her mother rarely phoned. Being her first time admitted to a hospital ward, her friends could not visit her. Being on Mahe, she cried her eyes out every single day. She felt alone in the small world, frightened, and could not see a light at the end of the tunnel. Depressed, cried every day. Eventually, she and her baby was discharged home, but she stopped breastfeeding the day after discharge and opted for bottle feeding. Okay. Cheryl and her baby had postnatal visits 10 weeks after delivery because the nurses were redeployed in COVID-19 health response, namely PCR screening and vaccination. There was no midwife at Ganton's clinic because she was in isolation due to community transmission of COVID-19. This is a case study, okay? During her postnatal period, Cheryl encountered occasional bouts of dizziness, but her mother said it was normal because she has to wake up several times to feed the baby during the nights without much sleep. During the postnatal visit, the nurses discovered Cheryl was hypertensive, and she was referred to the doctor for further management. By the end of 3 months after delivery, Cheryl, her blood pressure was well controlled, and her baby, whom she loved dearly, had gained weight and thriving well. She named the baby... Really? Ashley came in, leave the building. Ashley Bukhari is her name. Ashley, after her father. Cheryl's mother was happy because Cheryl, being very young and naive, did not tamper with her pregnancy. As today, Ashlyn is bringing much joy to the family, being her first grandchild. That's it, Miss Rosie? Yes. So that was part of the maternal child service, because in the absence of Miss Bresson not being here, we presented you with a case study so that we can have points of discussion about it. Okay? Thank you. So now we're going to have the panel discussion. So you want the people that presented to come on the discussion panel board. So that would be Evelyn, Florida, Rita, and Lindsay. Okay? Have a seat.
Let's switch off the screen.
Yeah, would be good, right?
Yeah.
Dis-moi. Ça n'est-ce qui sorti par là, yo aussi monté. Have a seat. Allez, Olili. Sylvie? Sylvie Bella? S'il vous plaît? Montez. N'a pas seat? N'a pas de seat pour. Merci pour step up, pour nous examiner ANC questions. Ok, Miss Liz, ou pas ça peut venir, ou si vous venir devant là, Et l'autre aussi? Billy? Okay. All right, nous parlons. So, nous pour commencer, nous avons demandé une question spécifique et nous pour documenter une conclusion, une recommandation et we'll bring it further. Seulement, throughout the event, il y a quelque chose qui come up to the forefront et ça type bon matin plutôt, c'est un mot qui tu servir quand c'était leadership. Et moi, quoi, we are leaders, but côté que nous pouvons faire as leaders. This is very, very important. Are we given the opportunity to be nurses, leaders, or what is it that they find qui y a une défaillance dans nous, qui nous pas portray ourselves as leaders? Second is procurement. How do we retain and keep staff? How are they going to invest in nurses and safety? And Ms. Liz, you have others?
Ok, suivant, on a mental health support. Ils ont une présentation, si vous sentez aucune question, le mental health support, qu'a demandé. Bon, best practices, ils ont senti qu'il fallait d'autres units to deliver. Bon, work cultures and equity.
Okay. So, lequel premier clé demande une question avec panel? Vin microphone, go ahead. Et ça qui deuxième pour demander une question vient derrière lui, so n'a qu'à expedite time. Allez.
Good afternoon.
Good afternoon.
Mon question est directe pour Miss Momo.
Oui.
Moi vraiment content de présentation. C'est mon question il parle opérationnel. Et puis sur le mental lui-même. On cause un peu de bonnes figures. C'est un bout de machine catch up pour dire 90 something qui admitted. And only dans 13-12 qui yes qui so mon quoi comme si and then uchi support ça uchi servir référence quand tu dis uchi dit que c'est la vie pour pas résoudre la vie so mon question est-ce qu'ils ont une grande ken l'aide le côté thérapie mentale quelle façon et sinon si ou quoi que vous avez besoin merci.
Excellent.
Merci pour la question. Non, nous n'avons pas aucune thérapie. Et n'a pas personne aussi qui a des questions en relation avec sa CISE. C'est ce que vous avez dit qui vient là. Et raison qui il a me compte peut-être pour faire dire monde comprendre que nous peut go through. M'imaginer avec sa bonne stress qui peut exister à ce moment. Pour déployer staff dans minute qui situation stabilisée et peut retirer, c'est vraiment difficile pour faire provision ou bien pour faire l'état. OK? Et mon raison que mon amène ça par mon dit c'est pour adresser qui ça tient un problème pour qu'il n'a pas gagner l'aide nécessaire par exemple pour bonne qui besoin. Merci.
Elle dit mon une autre question? Merci.
Evelyn, thank you very much. You brought tears to my eyes. I lost my husband at in 16th of January. Et nous avons une recommandation qu'on mettait about the spiritual aspect. Dis-moi là aujourd'hui si qu'est-ce que peut faire pour un patient qui est bien malade et il prescrit pour mort pour autres au lieu de se prendre en contact mon la tête tapé là-dedans ils se prend en contact avec ça dit mon de 6h30 au matin 7h30 au matin 8h30 au matin pour dire l'infini mort quel aspect spirituel émotionnel pour dire ça dit mon mais que pas capable venir un petit coup na mettre un pipi ou si capable perdre ou dernier rester au dernier temps quand même ça attrape son lendemain si un est li capable rester dans sa pipi pour 24 heures on l'a tête tapé là dedans à cause mon poko moi aussi pareil par au perdu moi aussi, je pas gagné counseling, malgré tout ça qui est arrivé. Je fais mon écrit partout, la télévision, le SBC, mais seulement, still, I feel so emotional about it. On connaît, je gagne place dans des situations mal, autres aussi comment travailler la santé, moi aussi, moi travailler la santé, lundi, mon paie mort devant eux. Comme si quel aspect qu'ils ont amélioré pendant ça les temps. Nous péco janvier, mon péco janvier 2021 jusqu'à là 22. Merci.
Madame Toufay, merci pour vos questions. Pareil, mon fait référence auparavant. Nous avons redéployé dans l'endroit pour nous travailler. Nous avons des circonstances qui sont vraiment difficiles. Mais le temps que nous t'y voyons, en effet, le temps que nous t'y voyons pour dire que quelque chose nous besoin améliorer pour donner confort, ça patient qui l'a lié aussi sa famille. So, quelque chose qui m'a initié, c'est que mon intentine qui est un petit peu active contre l'église. So, moi, je lié avec lui pour faire nous gagner la prière avec Père Saint-Dor. Et moi, vraiment apprécié que Père Saint-Dor envoie nous un peu la prière. Une fois que là, si je descends côté ICU, the main ICU Perseverance, mon attache à la prière, mon mettre les notice board, et moi, j'informe tout le staff, même le staff Lord, qu'ils sont capables de servir la prière pour faire avec patient. Et l'autre quelque chose aussi que nous fait, c'est que, oui, nous qui sommes là. Parfois, nous aussi, nous la fatigue. Moi, pour dire personnellement, la fatigue est testée persévérance. Et n'arrive le temps, quand moi, je n'ai plus envie de faire la prière. Mais c'est le moment où tu là, où tu as appelé sa patient, c'est faire la prière, qui même si vous perdez à longue durée. À cause, on n'est plus même connaît que pour prier. Je me rappelle même un jour soir, nous sommes madame enceinte, nous t'y perdu. Docteur Sakai demande moi, where is your God now, Miss Momo? C'est le parole que moi tu réponds, moi je dis bah tu n'es tout qui pas avoir fait. Mais même moi pas ni même connaît si moi tu connais la foi. Comprends? Moi connais pas juste moi connais là beaucoup les autres travailleurs, même nous bonnes healthcare assistants, même les autres docteurs qui nous débutent nous n'attendons nos patients et nous fait si qui nous donnent sa dignified death. Oui, c'est difficile, mais moi connais que tout staff qui travaille persévérance, nous build up a very good team. Et je connais que nous give the best pour sa bande de monde qui nous perdit. Merci.
Thank you, Miss. Un petit coup, hein? Thank you, Miss Momo, pour vos réponses. I'm sorry pour loss et sorry qu'on a besoin hear the news that way. I'm pretty sure your journey will teach other people how to be more compassionate. And COVID really hit us and made us think on our head, not our... So as infection control in mortality, peut-être in the dying moments, it would be advantageous that somebody downs PPE, moves to a secluded location, and at least have the mental comfort of holding their loved ones as they pass. Passage of a loved one is spiritual, mental, and also psychosocial. You never finish saying goodbye unless you see the person saying goodbye to. So there was something, Beryl, you wanted to acknowledge?
But les support Miss Momo.
Oui.
À cause mon tien bonnes qui se fait travailler dans ICU. Il y a pas de note.
Et toi, tu es d'accord?
Bonjour, je m'appelle Annabelle Cado. Moi, NARS, je travaille à la Public Health Authority, mais c'est bon. At one point, l'année passée, je travaille dans ICU. Si pour support Miss Momo, il y a important de noter qu'à that time, dans ICU, tu as on average 3 à 4 nurses, c'est loin. Là, il y a des nurses, des Indiens et des Sri Lankans. Et il n'y a pas d'autres qui soit pas la prière, papa, vous comprenez? Comme si mon papa dit, pas qu'on fait la prière, mon papa dit, pour te faire la prière, bon Dieu, c'est loin. C'est différent. So, la plupart du temps, nous-mêmes, nous qui tu peux faire la prière. Yeah. Et tout le temps, tu choisis, ou peut tourner, ou faire morning shift, faire afternoon shift, ou peut faire la prière. Nous essayons nous mieux pour nous faire la prière, prier avec bon patient. Mais il est difficile, par exemple, on peut dire. On peut tester une quantité nous la fois. At the same time, on fait un travail, par exemple, on peut dire, there was a point que nous pouvons faire tout. Nous n'avons pas healthcare assistant. So nous pouvons faire tout, literally everything. Harness, keep you at the ICU. So it was difficult sometimes and there pour find some time pour faire la prière. Mais c'est bon tout le temps, les temps, pas chercher à that stage. Que mesmo tu peux dire nous connaissons nous finissons faire tout ça que nous avons fait so nous essayons ça pour nous faire la prière mais c'est pas reconnaître not every shift tient un nécessaire là j'ai un shift qui n'a pas du tout nécessaire là so obviously pas tout le monde qui gagne sens pas nous veut dire gagne sens faire la prière merci
merci. Nous totally acknowledge our input et pas nous peut learn, non? Nous peut learn how to do it differently, laisse-moi mon masque. Nous peut learn what les temps où nous donne information, il y a une position nous ka défendre, soit nous ka apprendre. Et the point of the symposium is to learn. When we hear people's pain and we hear your difficulty, we acknowledge your difficulty. Nous acknowledge tiens quelque chose culturel qui partie conducive et une bonne question qui mais trop présent du monde musulman qui tu peux mort ou catholique présent. I mean, il y a culture ou quasi dire la prière pour lui. I mean, moi c'est ça tu peux dire culturellement il est différent pour tout le monde. Anyway, ça y a une chose spirituelle qui nous besoin acknowledge qui it was hard and nous apprécier le fait qu'on a fait it et hopefully next time nous a fait un peu plus bien. Moving on, monsieur.
J'ai mon travail maternité et une expérience un bon pays maternité d'aide. J'ai un qui me rappelle, un jeune madame, moi je me parlais. Et il n'a pas regardé que ça qui est présenté. Et ça m'a quoi, pour moi, c'est une mauvaise décision, une décision qui est vraiment tardée. Et je casse sur madame, peut-être, pas sur madame, et sur ses enfants. La question pour le moment, il n'a pas regardé ça qu'on peut dire. Aujourd'hui, on a 92 mois qui sont entrés et 35 qui sont sortis vivants. Okay? Et patients ratio, tout staff, c'est plus ou moins un est 3, un à 3, un à 4. Et on cause un peu de recommandation pour dire besoin plus train personnel qui m'a agréé coup. Et mon quoi il entier dans le système entier, il pas juste ICU. Et question, est-ce que tu crois ou quoi que si tu as plus train personnel, ok, et tu te concentres plus les autres patients sans faire les autres devoirs qui non nursing duties, tu peux changer sa outcome.
Jimmy, une question vraiment intéressante. Même si nous tenons les autres duties, parce qu'il y a une église, ça ne va pas agréer. Nous te donnons tout pour patients. Deuxièmement, COVID, connaît comment faire référence à ça. Il paraît qu'on gagne ou à munitions, on gagne mettre un battlefield, mais on ne peut pas target. Si je vais expliquer de la façon. Ou petit physique pas tout. Ou gagne moi. Il s'agrine à cause où voit sa pattern. Parce qu'il commence à venir. Saturation l'oxygène commence à descendre, les cailles commencent à battre vite. Et à l'endroit qui nous peut faire beaucoup de tests, donc le docteur peut masser qu'il y a une machine pour nous guetter, qui peut arriver, que nous les autres interventions. Ou voilà, les autres right ventricle commencent à dilate, notre cardiac output commence à reduce, ou peut donner un vasopressor pour faire ça les cailles battre, pour contracter les plus. Ou par contre, que pour faire, Jimmy? Ou vit patient, il vit patient 20 ans en bas to improve ventilation. Nous vivons en bas, parce que nous gros dit mon 150, c'est pas combien de kilos. Un peut veiller la tête, 4 nous peut se virer, peut l'aide pas tout pour nous virer. By the time nous finissons virer prone. Docteur dit, oh non, pas pourquoi pas continuer comme ça, il continue de saturer. Première fois, on connaît que c'est soft right, soft left, full right, full left. Nous ne virons, non. Comprends? Moi, pas quoi. Anyway, peut-être l'établissement ne réussit à sortir, à voir si c'est quelque chose qui est différent. Mais c'est moi pas quoi. Moi, quoi, nous donnons le maximum à ce moment-là. Hein?
So, Miss Momo, ou pas quoi pour dire such a greater staffing percentage, it would change the outcome? Ça, c'est sa question.
Probablement, oui.
OK. OK, Monsieur Jimmy? Probablement, si it's a higher staffing ratio, the outcome would be different. It's probably not. Is that not what you said? The question, un petit moment. The question qu'on demandait, c'était si tu as plus staff,
Please train.
train staff, would that help the outcome? Nous pas connaît, oui, nous pas connaît, nous n'a pas l'évidence de ça, mais ça c'était sa question, et nous besoin de sa question.
À cause il nouveau et nous pouvons préparer.
Oui,
Okay.
définitivement.
Et moi, rappelle, le premier cas maternité, tout le monde travaille dans le PPI, tout le monde met PPI, met masque, ça veut qu'on a qui vient arriver. OK? Et moi, je me demande, qu'est-ce que tu peux faire? Connais? Et il y en a, les gens qui ont patients, ils sont sur dehors avec son PPI, ils parlent sur le patient.
OK.
Donc, on peut que nous infecter nos corps et vu que Dieu vous dit un staff, Ritan, dit qu'on peut acheter un staff qui est infecté. Et qui est infecté? Est-ce qu'il code nous dans ses mains ou bien qu'on travaille? So we never know. We never know. Mais c'est moi l'obligé. Un staff qui est infecté, moi je vais oublier qu'on travaille. Mais qui nous fait? Nous façon faire. Et peut-être ça, peut-être tu as répondre ça.
OK.
Okay, just to, in terms of healthcare work infections, Jimmy, Paris nous montre un report par exemple qui sortit tous les mois. Et là nous faisons une case investigations, nous call haben focal person, nous call saban nous staff qui est infecté. Majority of nous ban staff sont pas infecté occupationally within the health setting, même si you know have defiance in terms of PPEs, they are being exposed outside in the community, non-exposure, non-occupational exposure qui est arrivé. Et ça nous nous avons recherche et you know dans l'évidence. Et nous capable dire it's not happening dans le travail. Il y en a un pourcentage, mais pas patient tout staff, mais plus sa collègue entre les autres. À cause nous, là nous parlons avec patient par une dit, nous gown up, nous mettons tous nos pipi qui en a qu'à tirer dans le store, mais là nous avec nous d'allons, nous pas voir pour dire nous d'allons could be the source of the infection, nous pas voir as a threat, so nous let's nous guard down et la co-transmission est arrivée.
Okay, so
thank you.
Mon guy another question or of a different subject, mais m'histoire il y a une question pour demander. It was
It's not a question of defensive. It's not a
it's a
question.
discussion.
It's just like you rightly said. It was a pity we couldn't give them more staff. We knew they're suffering because we have to mind to ICU. The main ICU, though when there's excess 6-bed ICU, the more you spread, the more you need more nurses.
For sure.
But as we were talking about task shifting, what they really knew, we were working with, is to train people to assist them with the turning so that they will have more time to do the care that the nurses need to do. Task shifting, we've been talking about that over 4 years. So this is what we can come with recommendation. We can't have nurses, but we can have other staff trained to work, specifically trained to work alongside these specialties.
Okay.
Thank you.
All right. Miss Noké, une autre question. Jimmy, on a une autre question, ça?
Madame Bijou.
Quiet, please. On continue la discussion. We might not agree on everything, but it's a discussion. Madame Nissette, vous avez une question? Shh. Bana, quiet.
Bon après-midi.
Bon après-midi.
Je m'appelle Madame Nissette.
Oui.
On est le premier groupe du monde qui est dans l'avion qui est COVID-19.
Oui.
On est dans le Maurice.
On a fait un petit massé, ok.
On a fait un petit massé. So, là, nous là-bas, Maurice, il dit, nous ne pas capables de descendre à cause de la COVID-19. Nous ne pas connaître qui ça COVID. Nous, première fois, nous tendez. So, première fois, nous tendez, nous payons la frayère, ça la frayère. Moi, je ne vais pas expliquer aux autres, ça la frayère que tu as. On peut demander avec qui Cécile, qui sa qualité maladie, moi je donne un signe pour 39 ans, sans même montant sa qualité d'affaires, montant les autres maladies. So, nous avons demandé pour descendre. Nous descendons aux Seychelles. Les montres d'avion, nous tous ça qu'un site. Là, qui ça fait? Mon petit dans le. Mon garçon est assis là-bas. Par exemple, maman vit, oui. Maman vit assise au bord. Par exemple, ça me dit, maman, pas capable d'assis au bord. So, moi, assise là, m'ont fait faire raison. Avion, il a posé, débarqué, il dit, nous, Pélani, saute pas. Mon garçon est devant moi, il saute son lait, il y a là-bas, bis, les moguettes, bis, il y a l'autre tamac. Moi, les gars, ils battent, sale l'expérience. Maman, on peut dire autres. Présent, mon garçon est couple là-bas, monsieur dit, ou madame, moi, le sein. Moi, dit, non, mais on est mon petit. Mais il y a une grande femme comme ça, on est mon petit. Il dit, non, on va aller là où on finit à arriver. Vraiment, allez, ma sise de habis, moi. Mon père, mon petit côté qui boit, il a la sise de habis, mon guetté même, pas aller. Après, moi, aller lever la mec, moi, comme ça. Moi, sise même, on peut faire raison. Moi, je dis, la côte nous était là. Pour couper short, nous commençons à bouger. Il me dit, un bis, deux, moment de troisième. Là, nous cassons sorti pour la porte. Sa petit gars, il met sa petite sirène, sa petit motel.
He said, my pretty sure on a histoires à côté.
My friend, moi, tu crois mon paiement? Moi, dis, mais qui arrive, c'est là qui peut mettre ça la sirène comme ça? Nous allons même, pas comprendre, mon Dieu, mon bloui. Nous arrivons là en ville, coton, d'Ipam là.
Hein?
Des petits garçons, 3 autres, au bord de ses mains, ils crient, maman, on nous taille COVID. Mais, pas de rier, mais parti pour rier. Ça, là, il dit ça. Les autres, moi, les cas, ils battaient même. Moi, je dis, moi, pas qu'on est là côté, mon peut aller. Il dit, nous pouvons aller au Ballon-Bé. Nous montons avec beau Ballon-Bé. Débarquer. Nous montons, nous sommes là sans pour aller. Là, on arrive là-bas, mon sentiment, tellement, je ne sais pas qu'on est mon sentiment. Je dis que mon garçon m'a dit, mets de boulot, on va faire un petit guindité, comme si mon faible. Présentement.
Covid n'arrive pas Ballon-Bé.
Il dit, moi, qui boulot? Il y a juste boulot là. Il n'y a pas rien là pour guindité. Dis-moi ça. Moi, je dis, qui m'ont pour faire? Il dit, moi, espérer. Mon nom, madame Denia, ma colle. Il m'a dit, là, je vais l'osso. Il colle, madame Denia, il fait, et madame, je vais payer l'osso pour moi. Mais mon pan bien, même, là, arrivé, mon quoi, à peu près 20 minutes, mon commence à sentir mon légué palpiter.
Est-ce que tu gagnes COVID ou tu es de quarantaine?
Moi, tu es de quarantaine à cause de nous tous. Nous, tu veux avoir une quarantaine.
Si ça m'en oui.
C'est sa façon.
Oui.
Présent, madame Denis dit, il y a le docteur Gédéon. Il y a dit qui pour faire avec moi. Docteur Gédéon, il dit, moi, à côté moi, après, moi qui a posé avec moi. Mais mon appel, moi, C'est même pour prendre mon autres un peu, non? Oui, mais la bilance finie. Pour moi,
la sirène encore?
On met le compte moi. Là, on arrive, c'est moi, mon petit gars est bien occupé. N'est-ce que tu colles moi? N'est-ce que tu amènes fleur pour moi? Mais c'est stocké. Là, il a mettre mon fruit, le barreau, là, il fait crier. Moi, je dis, mon petit fruit, m'a dit, mettre le barreau, il dit, pas venir dehors. Moi, si c'est en dedans, là, il finit à aller, maman, allez, me prendre ça. Moi, les autres 10 autres, merci.
Well done.
OK? Merci autres, tout.
Ah, merci, Madame Lissette. Jimmy, tu as une question, soit tu as une autre question. Allez.
Il y a une question.
Allez.
Pour Madame Bijou. C'est une petite question beaucoup. Vaccination program, c'est very good. C'est vraiment une question. Pour une meilleure pensée, si peut-être c'est un endroit ou bien même côté, tu n'as pas de dire que side effect qui gagne avec vaccin. À cause de moi, madame, tu as un very bad side effect. Et je m'arrête point moi, je me occupe pas carrément assez. Et je rapporte ça qu'à aujourd'hui, et je me comme ça, et pas rien faire avec le vaccin. Et si on a une relation avec le vaccin, c'est ça pression deuxième dose de vaccin. So, on va prendre peut-être, ça pour ça, et peut-être plus tard, avec ça, un side effect, qui va dire mon petit gars, peut-être capable de faire comment l'éducation. Moi, je dis, on peut pas encourager, I don't know.
Ok, so nous ne pas à point.
Oui.
Nous ne pas à point. Madame Bijou, for the future, merci.
Non,
Nous input.
peut-être mon cher content répondre pour dire nous avons un surveillance system pour vaccination advanced event following immunization. Dans nos training, ça advanced event following immunization, c'est topic qui nous cause là. Et even avant COVID vaccine, nous trainers sur even effects après vaccination. Nous informons qui n'importe qui dit mon n'importe quoi qui dit mon veut dire les autres qui ont gagné après vaccination. Donc supposé peut remplir si ça dit mon vient rapporter. Nous avons des guidelines qui tout health center y en a concernant adverse event for immunization et nous avons un comité qui supposé un comité il est actif. Là nous avons une case, nous supposé investiguer pour regarder si relation avec sa vaccination soit si confidential si quoi. So peut-être on pas connaître que ça bandi mon casualty, on pas connaître si autres pas vraiment au courant et bien faire nous reconnaître faire nous dire nous ça. So nous besoin follow up, go back to casualty, retravailler avec autres et nous quoi nous besoin renforcer un petit peu pour strengthen un petit peu sa surveillance qui dit mon y va tout dit mon y va azo avec ça. À cause le ward dans docteur ça mène vinn donne le docteur descend lui même le ward il mène autres papiers autres remplis vinn donne nous. Et dans la clinique qui peut faire, sur mon magazine, peut-être qu'à jour, on va connaître un petit peu, si on n'a pas assez d'informations, si on a besoin de go back, peut-être restreindre un peu sa surveillance, à cause des surveillances qui existent dans le ministère de la Santé.
Bon après-midi. Je m'appelle Julio Charles, staff nurse at ICU Family Hospital. On commence ma question par un opening statement. Who cares for the carers? OK? Mon série question, car je répondre par panel ou bien bon 10 monde dans la salle. COVID-19 in tap Seychelles, full force. Ça can y tirer les autres units. Whatever qui peut passer, ça can y donne un coup de lead. COVID, it was blessing in disguise. Il prend beaucoup de nous. Il fait nous remarque beaucoup de différences de système de la santé, nous delivery, healthcare delivery. Il aussi amène beaucoup de bénéfices de toute façon. Alors, c'est pour une question comme suivant. Quel long terme ministère de la santé besoin de monde dans un poste clé pour développement de nurses à long terme? Et est-ce qu'il y a une décision qui gagne fait au niveau quotidien? Il gagne fait au niveau consultation, au niveau opérationnel, entre bonnes nurses et les autres monde qui sont dans sa unit. Et qui bonne l'approche holistique nous peut prendre towards bonnes nurses et bonnes healthcare assistants. Merci beaucoup.
Merci. Julio, oui, merci. Je ne sais pas lequel premier le panel pour take on. Hold on. Si tout le monde est causé, on ne pas. Allez. Okay.
COVID-19 has just highlighted it. Caring for the carers. I was a nurse a while back. The reason why I left was I burnt out. I was doing HIV/AIDS at a time where we couldn't talk about it. We had still had the blanket policy of no talking and no divulgence, and it took its toll. Now, apparently there was once a post that was a post for caring for carers, and then it got lost, and then recently they said that they didn't have, the post was not created, Gillian, or it was abolished or something or other, and it didn't happen. Now, this would not only be useful for COVID nurses, but also when you look at oncology, midwifery, the whole healthcare system would benefit from such a support system.
Okay, all right. So, Julie noted, and okay, go ahead.
Maybe something in regards to these questions, because the association is an association. It's not a government entity. But for the association during the COVID-19, for the nurses that we knew they were either infected or in quarantine or admitted, what we did, we tried our level best to support them psychologically. But except if we knew, if we don't know, say for example, Rosie Bistoke has been admitted, probably Madame May is the part of the organization. She doesn't know that I'm admitted, then we cannot have the contact. If we have members, because we did it for everybody, not only for the members of the association, but we work together with the hospital services, the Directorate of Nursing, to not inform us, but let the nurses know, those ones have been affected or infected or whatever, let the nurses know that we are there. They can give our numbers. If they wish to contact us or if they want us to contact them, it's fine. So we worked on that way, and on that area. So most of the nurses from the beginning, we had quite a number of nurses that we sort of support them, especially when they were admitted with a bouquet of flowers, small cards, and we call them, I don't know whether some nurses here have benefited from such thing. Any nurse? Okay, there are a few of them. But provided that it is something confidential. We cannot just go and ask Mrs. Wao, was Bistoke admitted? Please give me her number. No, we don't work that way. We let Mrs. Wao know because she knows her ward. She works there. We have to respect each other. Please tell Miss Rosie Bistoke when you go on the ward that if ever she wants to contact the association, so feel free. So most of the nurses, especially when they were admitted or quarantined within the outside, even within home or into the hotels that they are the isolation centers. So that's what we did, and that's what we're still doing. But unfortunately, the donation, we ran out of donations, so we had to sort of reduce the number that we managed. But we are still there to support psychologically the nurses. Thank you.
Okay, thank you, Mrs. Bistoke. So we've... Allez?
Now, can you make a question? Micro, please.
Hello, hi.
Monsieur Bao.
Ok. Après-midi, Kenneth Bao, NES. Mon question pour Miss qui travaille par la Miss Bella. Qui m'a ou comment NES Midwife aussi, moi connais. Qui ben plus gros challenge qui passe là-dedans avec Covid et qui vous pensez il devrait gagner faire pour aider les autres pour dans les futurs dans cette situation qui nous était actuelle. Merci.
Bon après-midi tout. Je m'appelle Sylvie Bella. Je travaille parler as a nurse midwife. Parler nous passe d'un bon challenge. Surtout when it comes to premature delivery due to COVID positive. Nous avons des preterm deliveries qui nous besoin de ça avec. Il y en a qui deliver on the way. Il y en a qui deliver en Haïti. Il y en a qui deliver depuis parler. Après, nous-mêmes, nous sommes midwife. Nous avons infecté les patients dans les barrooms. Ce n'est pas facile. Et là, nous connaissons que les patients sont positifs. Nous finissons de travailler 3 jours après que nous avons contact avec les patients. So, nos challenges n'est pas facile, mais seulement nous persévérer. Nous avons beaucoup de midwives pour aller, mais seulement nous donnons support camarades que nous sommes capables. So, nous faisons un bon travail. Et nous copions quotidien. Merci.
So, il y a des traditions que faire. Nous notons qui passent tout lunchtime. Nous passons le temps. So, si n'a pas encore question, na faire the vote of thanks. Et bon qui peut aller. Ah, il y a une question? On est, quelque chose que vous voulez dire? Allez, go ahead. Mike. Mike, là. Allez.
Moi, je n'ai pas une question, mais seulement, reste assured, nous écoutons tous les autres conseils qu'il y en a. Et il y a un outil launch a campagne, Compassionate Care. Alors, it starts with us leaders. We need to be compassionate towards our staff. So rest assured, all your recommendations to the concern will be taken further. So, merci beaucoup.
All right, thank you, Dr. May. So, nous notons, nous run out of time. Maybe we can do this at another time. Et continuously improve. Et pas nous pas payer award faults, but nous award places of improvement. So we'll ask Miss June to come for a vote of thanks. Thank you for your input.
Good afternoon to you all. I deem it a great honor and privilege to propose a vote of thanks on this symposium for nurses. Let me first of all start by giving glory to the Almighty God for making today's occasion a resounding success. We nurses and midwives, we are at the front line health care workers. We have worked tirelessly during the COVID-19 pandemic to save lives and prevent further infection of the virus. We were everywhere, responding to the health needs of the population, whether public service, private sectors. We provided nursing, midwifery care, and service in the prevention of the spread of the coronavirus. In treatment of critical nursing, midwifery care, and service in the prevention. Past immunization of the community, screening of our clients, patients and their family members, care of the mothers and the newborns, and of course, ensuring the continuum of care and services. In doing so, we were risking our own health and too often sacrificing time with families to help those suffering from COVID-19. As human beings, as carers, we have gone extra miles in coping with the COVID-19 health response, and also suffered throughout the pandemic, unnecessarily exposed to the virus and extreme workload. Quite a number of us had to be quarantined or hospitalized in order to gain back our health. I personally have gone through this terrible experience as a patient infected with the COVID-19 virus. This forum has provided us an opportunity to share case studies, our stories, and also learn from different topics presented. I am sure the recommendation will provide direction for further improvement in the nursing and midwifery care plan in the Seychelles, and at the same time promote a healthy work-life balance for all the nurses and midwives in preparation for the next health crisis if and when one should arise. On behalf of all of us present here today, and those who could not be with us because of the reduced number of seats in accordance with the public health regulations, let me congratulate that Nurses Association to this great initiative in organizing this symposium in commemorating of the International Nurses Day 2022. Thank you to all the political leadership of the Seychelles for all your support, and we hope nurses and midwife voices will continue to be heard. Thank God to the ICN leadership for including the nurses of Seychelles for this special event. Thank you all nurses, colleagues, and presenters for contributing for the success of this program. Thank you to the media houses and all personnel who contributed to this event. COVID-19 infection continue to increase. As nurses and midwives, we understand that the work is far from over. We know that every month, week, and day of the year, you are at the front line. I quote from President Barack Obama, with a beating heart of the medical system. I thank you all for your attention. Have a blessed afternoon.
Seriously, after today, I won't have COVID-19 ever again in my life. Anyway, there are a few people celebrating birthdays, and including Dr. May and a few others, so happy birthday to everybody. We will invite Ms. Sino to closing remarks. Yo copy kan coach lo sideline, o kone ban coach keep him the football lo sideline. Come on in. Thanks.
So good afternoon, everyone. As Gina has said, we've got 3 nurses in the audience that has their birthday today. Yes, we've got Dr. Gillian May, Miss Jean Fred, and Mr. Aaron Barak. Can you stand up, please? Happy birthday to you. Happy birthday to you all. Happy birthday to you. Thank you. So we've got 2 bouquets that will be presented to the 2 ladies, but unfortunately, we don't have anything for the male nurse, because it was, we were informed at the last moment and we knew it at the last moment. So happy birthday again, Aaron.
Sociale, sa couronne pas vous désharmonise, nous l'harmonie. 6 ans meilleure histoire, nous les a. Là, il sa moment sa vie les virus. Oh mon peuple, mon dit solidarité pour nous soutenir. Bonne devant nous la scène, nous saluons l'endurance et persévérance. Nous honorons notre patience. Solidarité pour maintenir conseil médical du soin. Et demain, on va réjouir de triomphe le ça qui n'arrivait hier. Et encore une fois, on va prouver que c'est celle des îles bénies.
It is an honor for me to address the closing session. Today's presentations focus on the impact of the chaotic COVID-19 pandemic, which has thrown our world into disarray and put an unprecedented amount of strain on our nurses and midwives. We also had the opportunity to hear from the varied group of dedicated nurses and midwives who shared critical experiences, struggles, disappointments, and even dread of the unknown while fighting the illness. Because visitation were prohibited, our nurses were connected for the families. And our nurses were also there for critically sick patients and those who died without a family member, which has taken a psychological toll on all of us. Our economy improved as a result of our nurses taking the lead in the mass vaccination campaign. The pandemic has also shown the chronic shortcomings of our healthcare system, including inadequate working conditions and insufficient healthcare staff. In addition, nurses from private clinics were involved in the response of COVID-19. But at the same time, this greatest health crisis of our time has reaffirmed the commitment and dedication of our nurses and midwives during the pandemic. The COVID-19 pandemic has taught us a lot. What we've experienced put focus on the strengths and weaknesses of our national healthcare system, and at the same time taught us we can make it better. We hope that the Nurses Association will address all the recommendations made today in order to improve the welfare of our nurses and midwives. So let us rise and give a last applause to all our dedicated nurses and midwives. I thank you all. Safe journey back home.
Hello. Nous connaissons provide lunch pour d'autres wish weekend. Mais c'est moi nous faire un petit heavy snack dehors avec un peu de jus s'il vous plaît. Si on a arrêté l'eau qui reste, les autres besoin prendre l'eau, on n'a pas de l'eau dehors. So on behalf of the Nurses Association, nous autres merci beaucoup. We shall see you again next time. Merci. S'il vous plaît, encore un petit message là, mais c'était Saint-Paul, cathédrale Saint-Paul dimanche.
9h du matin. S'il vous plaît, venez nombreux. Nous remercions bon Dieu pour ça la force qui nous donne nous qui peut combattre le Covid. Nous connaissons nous capables de faire. L'homme, s'il vous plaît. Ça qu'on aime si la zone s'en pose d'autres, pas besoin à laver, que nous avons un ticket 3 flots qu'on peut vendre, s'il vous plaît. 25 coupis.